Committee, if you would turn off your cell phones, please. Please note that item 3, SB 975, has been put over. We will begin with Senator Simitian, who is here. So this will be file item 13, SB 1431.
The only one they'll get is the negative. Thank you.
Senator.
Thank you, Madam Chair and members. This is Senate Bill 1431, deals with the County Health Initiative Matching Fund Program. This would allow counties who participate in the County Health Initiative Matching Fund Program to provide health care coverage to qualified low-income children who are unable to enroll in the Healthy Families Program or whose family income is at or below 400% of the federal poverty level. The bill addresses two specific needs. One is that this measure would allow participating counties to provide health care to children who may qualify for Healthy Families but due to unforeseen circumstances are not provided care. The other is the concern about the fact that when the enabling legislation was authorized back in 2001 and signed into law, the federal government provided matching funds for low-income individuals who were at or below 300% of the federal poverty level. In 2009, the federal government increased its matching dollars to include those who are at or below $400. This measure amends the County Health Initiative Matching Fund program so that participating counties can take full advantage of that expanded eligibility. It allows, obviously, the coverage of more kids, but here's the underscoring point I want to make for all of my colleagues, and particularly my Republican and fiscal conservative colleagues. We get 65 cents out of a dollar from the federal government, 35% of our local funds for these programs. That means if we don't access these funds, we're turning away almost $2 federal for every dollar of our local investment. We've sent $1.5 billion in federal money unused back to Washington. That can't make sense in anybody's book, and I respectfully ask for an aye vote.
Thank you very much. And before we let the witness speak, we have a quorum. So let's do the quorum vote, please.
Senator Alquist? Here. Alquist here. Strickland? Here. Strickland here. Onestad? Cedillo? Cox? Here. Cox here. Leno? Negretti McLeod? Here. Negretti McLeod here. Pavley? Here. Pavley here. Romero?
A quorum
Romero
is present.
Here.
Thank you. Very succinctly, please. We have a member who is leaving, and we need to get through a lot of things quickly.
Absolutely. Madam Chair and members, Tim Madden, representing the California chapter of the American College of Emergency Physicians. We're in support to the extent that it allows counties to expand their coverage to cover more children. We think is a good thing. We urge your aye vote.
Thank you. Anyone else in support?
Michael Radigan on behalf of the Board of Supervisors of Santa Clara County in support.
Thank you.
Farah McDade Ting on behalf of the California State Association of Counties in support.
Thank you.
Juliana Voris with the Urban Counties Caucus also in support.
Thank you.
Jean Fraser, the Chief of the San Mateo County Health System.
Thank you.
Angela Blanchard on behalf of San Mateo County in support.
Thank you. Is there opposition? Comments from committee?
I'd like
the bill.
Madam Chair.
The bill has been moved by Senator Pavley. Yes, Senator Cox.
Well, Madam Chair, I have looked at this bill very carefully, and I appreciate the work that Senator Simitian has done. He's a very thoughtful member of this legislature and a fine senator. But I asked Senator Simitian, is this sustainable? And I believe Senator Simitian said, no, Senator, it isn't sustainable. Now, I may not have said that exactly the way that the senator said it, But that's the problem with this bill, and that is that we're now looking at 400%, and it simply is not sustainable. And sooner or later, this legislature is going to have to recognize that we can't continue to do things that doesn't have some sustainability. And that's precisely what we have here. This is not sustainable, and this bill ought not to pass out of this committee simply because of the fact that as I mentioned, it's now 400%, and when you begin to look at that 400%, it simply says that the salary and wage, the income level is $88,200 for a family of 4. And Madam Chair and members, this is just not sustainable. And so I applaud Senator Simitian for what he thinks he wants to do, but in the final analysis, if you can't sustain it, you can't sustain it.
Thank you, Senator Cox. The bill has been moved. Quickly, very quickly.
Thank you. I want to try and bring Senator Cox and Senator Strickland and all of my Republican colleagues along in this bill. I don't argue that there is a sustainable source of funds at any one of the counties. But what I do argue, and I make these 2 points, Madam Chair, is the first is there isn't a dollar of state money in this program. So there's no burden whatsoever on the state. This is federal money that comes from the CHIPRA program that then goes as a match to local funds only. Those funds only go as a match if we are able to fund all of our needs out of the Healthy Families program, and the only cost of the state is an administrative cost which is fully reimbursed by the local program. So there ends up being not a single dollar here. The only question then is whether local jurisdictions will be able to sustain the program over time. Some of them may not be able to do this for the next 5, 10, or 20 years, but better they provide insurance to the kids they can for as long as they can than not at all, rather than forego the almost 2-to-1 match in federal dollars. As I said earlier, we're sending $1.5 billion back to the federal government that could be providing health insurance for kids here in this area. And finally, I think Senator Cox raises an important issue, and I'm glad I had a chance to speak to it very quickly, on the issue of how much is really a little too prosperous. Members, it's important to remember that California is a high-cost state. So when we're talking about the federal poverty level, we're not talking about a California number, we're talking about a national number. And guess what? 400% of the federal poverty level is actually 300% elsewhere in the country. So we really do need to be at 400% just to be at what used to be the old authorization of 300%. And then even within this high-cost state, members, we have high-cost counties. So when we're looking at that national number, in order for that national number to be California relevant, we have to keep in mind that California is a high-cost state. There are a number of high-cost counties. It is particularly hard for people of modest means, even middle-class folks, to make the nut on their expenses, let alone health care, in those high-cost counties, in this high-cost state. We need to remember that 400% would be authorized anywhere in the country, but it particularly is appropriate in this high-cost state, and I would respectfully ask for an aye vote. Let's not send that money back to Washington, D.C. We're already underutilizing federal funds and not getting our fair share.
Thank you very much. We have, we're ready to vote on the bill now. It has been moved. It's been moved by Senator Pavley.
Senator Alquist?
Aye.
Alquist, aye. Strickland? No. Strickland, no. Honested? Cedillo? Cox? No. Cox, no. Leno? Aye. Leno, aye. Negretti McLeod? Negretti McLeod, aye. Pavley? Aye. Pavley, aye. Romero? Aye. Romero, aye. Scott?
That bill has 5 votes. We will be holding all the bills open so others can add on.
Thank you to your staff for their help, and thank you to you for your role as principal co-author on the bill, Madam Chair. Much appreciated.
Members, this is going to be the order for the next 3 bills. It will be first Senator Corbett, file item 12, and then it will be Senator Padilla, file item 11, and then it will be Senator Pavley, file item 2. So with that, Senator Corbett.
Thank you very
And we'll be
much.
holding all the bills, the roll open.
Thank you very much, Madam Chair and members. I'm presenting SB 1390. SB 1390 makes a very narrow exception to the new prescription labeling requirements. This exception will apply only in those circumstances where medication is administered by licensed healthcare workers and not when it's self-administered. In health facilities where patients are self-administering their medications, the labeling requirements that are being developed by the Board of Pharmacy will apply, and in cases where patients are discharged from health facilities with prescription medicine, the new labeling requirements will apply. SB 1390 only applies where patients are being administered medications by a licensed healthcare worker in a healthcare facility. In 2007, I authored Senate Bill 472. This bill established patient-centered prescription drug labeling in California. And the purpose of patient-centered labeling is to protect California seniors and vulnerable populations from taking incorrect dosages caused by an inability to either read or understand prescription drug labels. The governor signed this bill into law, and the Board of Pharmacy is expected to finalize their regulations this next week. Senate Bill 472 was intended to address the situation where prescription medicines are provided directly to patients. We do have amendments that further clarify the limited nature of this bill, and the amendments affirm any and all existing patient rights. And also, these amendments will remove the opposition. Due to committee deadline requirements, the amendments will be taken in the Senate Business and Professions Committee, but the amendments are available for you to review today. The bill is supported by the California Association of Health Facilities and the California Pharmacy Association, and they're both here to testify today. And again, let me just emphasize, this is a very narrow exception, which I believe is warranted in these circumstances, to patient labeling requirements.
Thank you, Senator Corbett. 2 witnesses, 2 minutes each.
Jennifer Snyder on behalf of the California Association of Health Facilities. Yes, we are co-sponsors of this measure. I feel it's important that that healthcare facilities, when labeling is used specifically only by healthcare administrators, that they should be that the labeling should be used that's local to them. That this is healthcare facilities in particular handle prescriptions that that deal specifically with labeling that is meant to be voiced just for the healthcare professional themselves, and the consumer is not looking at the label and is not needed in this situation. So we think that SB 472 really didn't intend to apply to healthcare institutions, and we think this exemption for the board will be helpful in their deliberations and over the next year.
Thank you.
Next person on the staff.
Anyone else who would like to speak in support of the bill? Opposition? Comments from committee? The bill has been moved by Senator Strickland. Senator Corbett, would you like to close?
Yes, I would. I just ask for your aye vote, and I think it's a reasonable solution to this issue.
Oh, Senator Leno has a question.
I know you addressed this, but I didn't hear it clearly enough. So with these amendments taken in the next committee, the opposition then is removed?
Yes, yes. And they just clarify in what, and you can correct me if I'm wrong, clarify which facilities are part of this program where healthcare workers can administer the drugs without the specific labeling requirements, which are meant to protect those that are at home, administering their own drugs and need the assistance of the larger type size and information in the event there's some problem with the ability to understand the labels.
That answers the question. Thank you.
And you close, so we are ready for the vote.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
Aye.
Strickland, aye. Onnested? Cedillo? Cox? Aye. Cox, aye. Leno?
Aye.
Leno, aye. Negretti McLeod?
Aye.
Negretti McLeod, aye. Pavley?
Aye.
Pavley, aye. Romero?
Aye.
Romero, aye.
That bill has 7 votes, which is enough to get out, but we are holding everything open.
Thank you very much, members.
Is Senator Padilla here? have the list, please? Okay. Senator Pavley. And members, you may note that since file item 3, SB 975, was removed, it changed the numbering on all the measures. Senator Pavley.
Thank you very much, Madam Chair, and you're right, I appreciate being heard because this bill is being double referred to B and P. I'd be happy to accept the 3 amendments as suggested in the staff analysis, and I understand the amendments will be taken in the next committee. The 3 amendments just briefly detail the definition of providers of blood clotting products. Number 2, clarified the requirement that providers of blood clotting products have sufficient knowledge and sufficient clinical expertise. And the 3rd part was clarification of the Pharmacy Board's jurisdiction. And those were the 3 amendments. Appreciate working with your very competent staff. Senate Bill 971 is a measure sponsored by the Hemophilia Council of California and would establish crucial standards of service for healthcare entities that deliver blood clotting products to people with hemophilia and other life-threatening bleeding disorders. As we know, just a few decades ago, people with severe hemophilia suffered from uncontrollable internal bleeding, crippling deformities, and a shortened lifespan. For most of these people with these bleeding disorders, this necessitated intravenous injections or infusions of prescription blood clotting products several times a week. And there's some horror stories that went on because of not having some of these standards in practice and in statute. In the past, some pharmacies would leave clotting factor on patients' doorsteps out in the heat. This spoiled the product, which is an expensive biologic and could have resulted in harm to the patients. This bill would end those kinds of practices. As of July 1st, 2010, any pharmacy wishing to provide blood clotting factors to patients on Medi-Cal, California Children's Service Program, and Genetically Handicapped Persons Program must sign contracts with the state that they agreed to meet standards similar to the standards put forth in this bill. These contracts were created as part of a state budget statute adopted 2 years ago by the California legislature and signed into law by the governor. And I should note, a couple of years ago, Darrell Steinberg carried sort of a similar bill that many people in this committee have supported. So if it sounds familiar, there's a reason. Senate Bill 971 would ensure that these standards be codified in statute for the public pay patients as well for all privately insured patients in California who have hemophilia or other bleeding disorders. Among the major provisions of Senate Bill 971, number 1 would establish standards of service for entities that deliver blood clotting products and related equipment, supplies, and services for home use. And number 2, promote access to a full range of essential, cost-effective, life-saving blood clotting products and related equipment, supplies, and high-quality services for home use for persons with hemophilia and other blood clotting disorders. With me today, I have Tony Maynard, a member of the Hemophilia Council Board, who is also a person living with hemophilia. Also with them is Dr. Jerry Powell, a hematologist practicing at UC Davis Medical Center.
Thank you. 2 witnesses, 2 minutes each.
Terry Calgar-Hill, on behalf of the Hemophilia Council, I'm here to answer any questions after their testimony.
Okay. Again, my name is Tony Maynard. I'm a person with hemophilia. I have severe hemophilia, and when I was born, there was no adequate treatment for hemophilia. So I've seen quite a revolution in my lifetime. These products, because the population is so small, are extraordinarily expensive, and we are concerned about making sure that the standards of care, of delivery, are there so that we don't have any loss of these very expensive products, as well as damage manage the availability to individuals. When there's a bleeding episode, the more rapid the infusion of the particular factor, the more quickly the episode resolves. And so we find that this is a time-critical issue for people with hemophilia, and so we find that the standards of these bills, the standards set forth in these bills are perfectly acceptable in ordinary practice in general, and would only, drive to clarify for any pharmacies that are not meeting the standards currently that this should be the basic level of service. We have worked with various organizations concerning this, and recently the California Society of Health System Pharmacists, after our negotiations, went neutral on this, and so we're willing to work in any way possible, but these standards currently are not as stringent as what would be provided in the contracting that will be coming out with the Department of Pharmacy for CCS and GHPP. So I hope you're able to support it, and if there's any questions, I'd be glad to answer them.
Again, I'm Dr. Jerry Powell, professor of medicine at the University of California at Davis. Most of my clinical work is as director of the Hemophilia Treatment Center at the University of California of Davis. We're one of the original federally funded hemophilia treatment centers way back in the 1970s, and so I've seen a lot of the history of development of hemophilia treatment. I think California has a lot to be proud of. The gene was discovered and the recombinant protein was developed in the University of California. We did the original clinical trials that brought the recombinant gene and the protein to our hemophilia patients. What I'd like to emphasize for this particular bill and support, two aspects. One is this protein is a biologic. It is not
Excuse me, I'd like to have all conversations be taken outside. Thank you.
So the first thing I would like to emphasize is that this protein is a biologic, which means that it can't be 100% chemically defined, and therefore each biologic product is a little bit unique and each patient responds differently. Therefore, we very strongly feel that standard of care requires patient choice. Each of the different recombinant protein, factor 8 or factor 9, each patient responds somewhat differently to, and so a generic approach is simply not acceptable as a medical standard of care. The second thing that I would like to emphasize is what Tony pointed out, that a spontaneous bleed is precisely that. A spontaneous bleed can happen anytime with no warning at all, and our standard of care requires that it be treated within 5 or 10 minutes, which means home infusion of the product. There are approximately 2,700 patients with severe hemophilia in the state of California. There are more doctors than that in California, and so this requires development of expertise by me as a physician. All of that requires continual...
And in closing?
Pardon?
And in closing?
And in closing, all of that requires that California continue to set the standards of care, and this bill is the next important step in doing that.
Great. It seems that folks always like to say the most important things later in testimony, and sometimes it runs out past the 2 minutes, and we do need to adhere to this timeline. Okay, all others, just please state your name and that you're in support.
Thank you, Madam Chair and Senators. Teresa Stark with the California Medical Association. We are on record in support. However, the last set of amendments raised a small concern for us with respect to changing the obligation on the physician when they are writing their prescription for the blood clotting products. I have spoken with the author staff and the sponsor, and they are going to work with us on that, and whether it's even necessary to be in the bill and what the enforcement process is there, as the committee analysis also pointed out. But we are in support and look forward to working with the author on that.
Thank you.
David Gonzalez on behalf of the Plasma Protein Therapeutics Association. Glad to be in support of this bill.
Oh, thank you. Others in support?
Fred Noteware, representing CSL Behring. We're also in support. Thank you.
Madam Chair, members, Bryce Doherty on behalf of the California Society of Health System Pharmacists. You have a letter of record from us as being opposed unless amended. The bill as amended on April 7th removes our opposition, so we're neutral at this time. I just want to thank the sponsors and the author for working through a lot of those concerns and appreciate your time. Thank you.
Thank you. So we've had support, working on support, and neutral, and now is there anyone in opposition?
Peter Ellison on behalf of the California Association of Health Services at Home, and we are not in opposition. We're in a similar position as the prior representative. We have some technical questions, and we believe that in our discussions with the author, staff, and sponsor, we can further some technical issues we have. We think we'd like to explore trying to resolve those so that we do not have to have a position of oppose.
You are leaning towards support?
We are we are neutral. We are not leaning any which way at this time.
Thank you.
Yeah.
Thank you very much. Now, is there any real opposition? No. Okay. Comments from the committee? Senator Leno.
Thank you, Madam Chair. I'm strongly supportive of the bill, and I have a question that doesn't have reference to anything this committee will be determining, but the enforcement mechanism with the Board of Pharmacy, is there concern that there will be costs involved with that?
We have not heard directly from them. I'm going to ask my sponsors or Terry to respond if you have a comment.
We plan to meet. Terry Calgar-Hill on behalf of the Hemophilia Council of California. We do plan to meet with the Board of Pharmacy. Right now, the Board of Pharmacy has jurisdiction over pharmacies, and they do have to send out inspectors to regulate those pharmacies. This would just be simply a few more things on their checklist. Obviously, with budget cuts, they might have challenges in sending their enforcers out on as frequent a basis as we'd like, but we think it's still sufficient and should be minimal cost.
Sounds like a minor imposition. Good.
My staff has let me know that within a week or so, they'll be having a meeting with them to discuss that issue. My staff and the sponsors have done an amazing job in working through sort of what would appear to be a relatively simple bill on protecting people and putting in the statute the standard of care. But there's a lot of moving parts, and we're dedicated to working with any of the concerns some of the possible opponents may have.
Right. So even the chair couldn't squeeze out any opposition, so it looks like you're doing it right.
Senator Pavley, a succinct closing?
That was a succinct
And I move
close.
the bill as amended.
I ask for your aye vote.
Thank you. The bill has been moved. Call for the vote, please.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
Aye.
Strickland, aye. Honested? Cedillo? Cox?
Aye.
Cox, aye. Leno?
Aye.
Leno, aye. Negrete McLeod? Negrete McLeod, aye. Pavley?
Aye.
Pavley, aye. Romero? Aye. Romero, aye.
That bill has enough votes, but it will be on call, so
Thank
people
you.
may
Thank
add
you
on.
very much.
You're very welcome. As you can tell, we've tried to do some bills in a different order to be able to deal with the bills quickly that are double referred, as well as members who will be leaving. Thank you. Next, we have Senator Padilla, file item 11, SB 1255. Welcome.
Thank you, Madam Chair, members of the committee. SB 1255 will restrict the sale of sweetened electrolyte replacement beverages from being sold at schools during regular school hours. As you all know too well, childhood obesity has become an epidemic, not just throughout the United States, but particularly here in the state of California, and as a cause of diseases like type 2 diabetes and others with long-term health consequences. Studies have consistently found that greater consumption of sweetened beverages is associated with the conditions of being overweight and obesity among both children and adults. California moved several years ago to ban the sale of soft drinks at schools during the school day in an effort to address these conditions. SB 1255 would continue that effort by eliminating the sale of sweetened electrolyte replacement beverages for the same reasons. Madam Chair, the committee analysis points points out a need for technical amendments, which I am happy to accept, but the fact that this is double referred to Education Committee, I'd like to accept those amendments into Education Committee in case we have to accept some others. The analysis also makes reference to concerns about hydration issues. This bill doesn't seek to eliminate hydration options. What we're going after is the source of all that sugar when those electrolyte beverages are sweetened, and I believe there's a bill by Senator Leno, SB 1413, that addresses the availability of fresh drinking water that I think should satisfy the hydration concerns. With me to testify today on behalf of the bill is Dr. Linda Rudolph with the California Department of Health, and I would ask for your aye vote.
Thank you. Witness at 2 minutes. Welcome.
I'm Dr. Linda Rudolph, Deputy Director in the Department of Public Health for the Center for Chronic Disease Prevention and Health Promotion. As Senator Padilla said, obesity is a leading cause of preventable death that's significantly associated with heart disease, stroke, diabetes, cancer, osteoporosis, a variety of chronic diseases. In California already, 1 out of 9 children, 1 out of 3 teens, and 3 out of 5 adults are overweight or obese. We know that sugar-sweetened beverages are one of the largest contributors of a single food source to calorie intake in the U.S., and Harvard researchers have found that in children, each extra can or glass of a sugar-sweetened beverage consumed per day increases their chance of becoming obese by 60%. In California, studies show that the prevalence of overweight and obesity is higher among adolescents who drink sugar-sweetened beverages than those who do not. There's no evidence to suggest from a health perspective that drinking a sugar-sweetened sports drink or electrolyte replacement beverage is different than drinking a soda. Electrolyte replacement beverages were originally designed to be consumed only after long periods of intense physical activity, but they've now replaced other sugar-sweetened beverages as the beverage of choice for too many students, and there's no reason from a health perspective for students to be drinking these beverages during a school day as opposed to healthy beverage alternatives such as water or low-fat milk or fruit juice. We encourage your support of this bill because we think that obesity really is one of the most critical public health challenges that we're facing, and it's also a major contributor to healthcare costs. We need to address it in every way that we can, and this bill is one very important component of our continuing efforts in the Department of Public Health to lower the rates of obesity and protect our children from chronic disease.
Thank you. Other witnesses in support?
Teresa Stark, California Medical Association, in support for all the reasons stated. Thank you.
Alicia Sanchez with the American Cancer Society. A third of cancer deaths are related to obesity and overweight, and so we think that this is an important step. Sugar-sweetened beverages do, in fact, contribute significantly to caloric intake. In fact, in adolescents in 2004, sugar-sweetened beverages accounted for 13% of the total daily caloric intake of adolescents. So we think that this is an important measure and an important next step in our fight against obesity, and urge your support. Thank you.
Thank you. All others just say me too.
Kristen Herr, California Academy of Family Physicians, also in support.
Thank you.
And Jennifer Richard with the California Center for Public Health Advocacy, in support.
Thank you.
And Ellen Braff Guajardo with California Food Policy Advocates, in support.
Thank you. Opposition?
Familiar faces.
Madam Chair and members, Bob Ackerman with the California Nevada Soft Drink Association. Our member bottlers produce a variety of beverages, including electrolyte replacement beverages, and we think in conversations with the author and the administration that there's a better solution than a ban on these beverages entirely. A lot has changed since 2005 when the original legislation was enacted in terms of the beverage options available. When you look at electrolyte replacement beverages, for example, there are now no-calorie and lower-calorie options available that should be considered for this purpose. We think if this is about calories, The focus should be on calories and allowing beverages and allowing high school students who are being educated on proper nutrition to have access to quote-unquote healthier beverage alternatives, of which no and low-calorie sports drinks are included, as well as things like vitamin water and other low-calorie alternative beverages. So we're opposed unless amended. We think there's a better way to go about this and would suggest that looking at caloric content. The Alliance for a Healthier Generation, which is an initiative combined with the William Clinton Foundation and the American Heart Association, has school beverage guidelines, which our industry has endorsed and been a part of, and those allow for sports drinks, as the consultant's analysis points out, of up to 66 calories per 8-ounce serving. We think that's a better approach.
Thank you.
Kent Mercer, head athletic trainer at De La Salle High School. I was asked to come here and talk about my role with our athletes, and the key with what we do with our athletes is the overall education and understanding the importance of specific drinks and the role that it plays, whether it be a fruit drink or an electrolyte beverage, and that it is important that they're getting that sodium returned to their system for their overall performance, whether it be in the classroom or on the field. And it's something that takes place, every day as they need to replenish. And they need to have that understanding of the role that plays, as opposed to just not having that option at schools and being limited to just fruit drinks with high levels of fruit sugars, which can oftentimes cause gastrointestinal distress to the individuals if they drink too much of that. Thank you.
Thank you. All others, just say that they are in opposition in their name.
Valerie Nerith for the California Chamber of Commerce. We are in opposition.
Thank you. Anyone else in opposition? Comments from our committee? Senator Oaks.
I just wanted to have Senator Padilla address the caloric comments by the gentleman from the soft drink thing, if there's products that
sure, in his
have
closing,
lowered.
in his closing.
And I
Okay.
know you're under a time constraint. And
thank you. And Senator Leno?
Same question.
Same question. Okay, Senator Padilla.
Okay. Thank you all for your consideration. Before I address the caloric content, I do want to make clear to the athletic trainer and all the athletic trainers out there watching this committee hearing that this is not a complete ban on electrolyte replacement beverages in schools. This is a ban on the selling of them primarily through the vending machines. So I get it. I grew up playing baseball, not football, but whether it's football or basketball or anything else, we have the igloos out in the field, and we're not trying to touch that, particularly for students like Senator Strickland's kids who are so active in sports. That's a good thing. What we're gearing here, or what we're targeting here, is in and around the cafeterias during the lunch hour for, unfortunately, the vast majority of students who aren't as active in athletic programs or on their own. As for the caloric question, the reason we chose the language that's in the bill before you is sweetened beverages. Now, most of the beverages that are out there that we're concerned about the high caloric content is because they're sweetened with the sugars that they're sweetened with. The alternatives that the gentleman from the Beverage Association made reference to sometimes have other sweeteners, artificial sweeteners that have the zero or low calorie, but they have that sweetened taste, and there's still disputes and controversy on the health benefits versus the other health risks of these artificial sweeteners. So that's why the language before you is going to take out the sweetened electrolyte replacement beverages. If there's some that don't have the added sugar or the artificial sweeteners, like the Smart Waters that was referenced, those will continue to be allowed.
And that was your closing?
And I would ask for your aye vote.
Thank you very much. Call for the vote, please. Oh, we need a...
Yes, I move the bill.
Senator Leno moves the bill.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
No.
Strickland, no. Onnested? Cedillo? Cox? I beg your pardon?
No.
Cox, no. Leno? Aye. Leno, aye. Negretti McLeod?
Aye.
Negretti McLeod, aye. Pavley?
Aye.
Pavley, aye. Romero? Aye. Romero, aye. It's got 5.
That bill has 5 votes, which is enough to get out, but we are holding it open for others who may wish to add on.
Thank you.
Thank you very much. Senator Liu, file item 4, SB 998.
Hey.
Was that a reluctant?
It was our conversation this morning.
Good afternoon, Madam Chair. Thank you. Members.
Chopped liver.
Mr. Senator Padilla caused a stir here.
Yes.
Madam Chair, members, Senator Alquist and I bring this bill to you today, and we appreciate the collaborative efforts of many individuals, organizations, and stakeholders. We've held 2 public hearings and many meetings and conference calls to reach this point. The sergeant is passing out
Excuse me, Senator Liu. If you could take conversations outside, please, we would really appreciate it.
Thank you. The sergeant is passing on amendments that I would like to offer today that reflect the suggestions of your staff. Scott Bain, his work on this bill has been exceptionally helpful, so thank you very much. As amended, SB 998 will bring about 3 important reforms in long-term care. First, it provides case management and transition services to individuals who enter a skilled nursing facility and need assistance to get back home, or those who are at imminent risk at being placed in a skilled nursing facility and remain at home with some assistance. Second, it creates a process to improve our assessment of what services these individuals need. And third, it leads to a better data set about the, I've got ears and a nose problem here. And third, it leads to a better data set about those Californians who are in need of long-term care, so our planning and budget decisions will improve. Persons in need of long-term care in California often want to stay in their own homes and return to their home as soon as possible after surgery or an incident such as a broken hip. There are many services available to them now. However, for the most part, the aged or disabled individual must navigate this set of services alone. Each service may require its own assessment, have its own office, or depend on the individual to know about the service and make it work. This bill takes a major step toward establishing an integrated system of long-term care with case management for some individuals. It establishes case management and transition services in every county, starting with providing these services to persons who have been in a skilled nursing facility for 21 days or more. We believe that providing these services to individuals, we will improve our compliance with federal and state laws, including the Olmstead decisions, add to the quality of life of elderly and disabled Californians, and save money. This approach works. Washington, Oregon, Pennsylvania, and Texas provide a small amount of social services and help with home modifications to get people home, which is where they want to be, at great savings to the state. Then the beds of skilled nursing facilities can be used for those whom that is the best placement, not the placement of last resort. I want to thank the Disability Rights California, the California Hospital Association, the California Association of Health Facilities, the Alzheimer's Association, the Area Agencies on Aging, the California Association of Independent Living Centers, SEIU, and people like former members Patty Berg and Dion Aroner for giving us some great advice. Although some of these organizations have yet to take positions, they are having a positive and profound impact on how this legislation is being shaped, and we will continue to work with them, with all groups, to amend and improve this bill. Our witnesses today include Brenda Primo, who currently chairs the state's Olmstead Advisory Committee, and Gary Passman from the Congress of California Seniors.
Thank you, and we will limit it to 2 minutes, 2 witnesses each.
I don't know what it is. I think it's...
Thank you very much for the opportunity to present today. I'm Brenda Primo, Director of the Harris Family Center for Disability and Health Policy and the Chair of Olmstead. By the year 2050, people who are 65 will double. People who are 85 will grow 5 times, and centenarians will grow 10 times. That's us. It's baby boomers and the generation who follow us. The baby boomers have never been one generation of individuals to sit back and let things happen to them. We have grown at a time when the world has changed technologically, medically, and in the ways that we think about our own independence. We have done wonderful things medically. Unfortunately, we have moved all care into the medical model for folks as they age, obtain chronic conditions, and forget that successful living is a cross between social, spiritual, and medical care. For folks with disabilities and seniors, the ability to live in the least restrictive environment, or the one that works for them the best, is the best goal. I like to say not long-term care, but care in the long term. Because there are many folks with disabilities who need the same services as seniors to be able to live in their own homes, and some of those are not medical. Some of those are home modifications, transportation, ability to get the meals and technology they need to continue to live in their own environment, the community, at the level they can live. This piece of legislation is an excellent first step to beginning to change how we feel about people with severe chronic conditions as a result of aging. By the age of 75, 75% of seniors will have some activity limitation, cognitive disability, or chronic condition. Many of those will want to live at home or live in a situation where they have the supports. I believe if we look at how we take preparation, we look at long-term care in terms of care of in the long term, rather than what we do at the last minute at the hospital and don't have options. If we create those options.
And in closing.
I love that, by the way.
Oh, thank you very much.
And
yes, I created that.
And
not
in
really.
closing, if we reevaluate who we are and how we want to live, I think we'll see the value of this bill. Thank you very much.
Thank you.
Madam Chair, members of the committee, I'm Gary Passmore from the Congress of California Seniors. First, I want to thank our author and our co-author of this legislation, two great senators who understand these issues and who have been very generous in their time and providing staff to work with stakeholders to move this issue forward. I suspect all of you know that California over the last generation or two has been a leader among the states in putting forth programs in the community to try to take care of the needs of people who can't really live in the community independently but need some help to avoid being in an institution. Tragically, some of those programs are threatened today, but that's to discuss another day. While we have put programs in place, we haven't done a very good job of integrating those programs, creating a system that is consumer-friendly so that seniors and people with disabilities know where to go, get help accessing the various programs that they need to stitch together to have complete lives. And this bill is important because it creates a roadmap. It doesn't accomplish the job, but it certainly creates a roadmap to get the state moving to creating that system of integrating care. The first step is to assess the needs of people who present themselves. The second one is to create a plan of care based on that assessment and completely focused on the individual client. The third one is helping that person manage their way through all of the various services, and then, of course, to reassess as people's lives change.
And in closing?
And in closing, we are strong supporters of this bill as a first step to integrating long-term care services.
Thank you. Other witnesses, if they would like to say their name and that they are in support.
I'm Tricia Blaisdell, and I'm here on behalf of the California Hospital Association. We currently have a support, if amended, position on this bill. We've been working very closely with the staff and appreciate their responsiveness to our concerns, and we look forward to continuing to work with them as the bill moves forward.
Thank you.
Robert Harris on behalf of SEIU, and while we don't have an official position on the bill yet, we've been working with your staff and the senator's staff, and we think this bill is going to end up being something that's really positive for all of California.
Thank you.
Laurel Mildred with the California Foundation for Independent Living Centers. We represent 26 statewide independent living centers working on behalf of 350,000 Californians with disabilities. We have a position of support if amended. We're working with the author to strengthen some of the positions, but we think it's a great first step in terms of implementing the Olmstead decision.
Thank you.
Alice Lowe, representing California Senior Legislature. We strongly support this proposal.
Thank you very much. Opposition? No opposition. Comments from committee?
Questions?
The bill has been moved by Senator Negrete McLeod. Before you close, Senator Liu, I'd just like to say it's been a pleasure working with you on this topic. And as one who has spent a lot of time on nursing home issues, it's a real pleasure for me to also work on legislation, in this case with Senator Liu, who's been the lead, to help keep people at home and in the community, which is what people really want.
Appreciate that. Thank you very much. I just ask for your support on this bill.
Thank you.
Thank you.
Senator Alquist? Aye. Alquist, aye. Strickland? No. Strickland, no. Onnested? Cedillo? Cox? Cox, no. Leno?
Aye.
Leno, aye. Negrete McLeod? Aye. Negrete McLeod, aye. Pavley? Pavley, aye. Romero? Aye. Romero, aye. Got 5.
That bill has 5 votes, which is enough to get out. We will hold it open for those who wish to add on.
Thank you, Madam
Thank you very much. Next, we have Senator Wright, file item 8. Welcome.
Okay. Thank you. And the committee offered some amendments that I think are before you. Without objection, Madam Chair, we would take those as committee amendments.
Thank you, yes.
They were drawn. Thank the staff for just the clarity in what they have done. Many of you from the Los Angeles area may have seen recently a series of articles that talked about the fact that we have nurses supplied by temporary agencies, and the business has proliferated now in the last few years, but we don't do any requirements or background checks on those temporary agencies. So you could have a nurse who almost had her license revoked work through a temporary agency and be placed in a long-term facility or a hospital. Now, on occasion, if you're auditing the hospital, as the state does, you might catch it, but often the temporary nurse may only work for a week or two, and then they may be in 2 or 3 different facilities. And because of just some of the difficulties in the nursing field, it may take a year or 2 years before, say, the action catches up, so that you could end up sometimes with a person who should not be working placed. What this bill simply seeks to do is to put some simple requirements of the temporary agency to at least verify that the person that they're sending to work, being in a hospital, long-term care facility, is minimally qualified to do the job that we're sending them to do. There are other things that we could do in terms of a harder regulatory format. This isn't the bill to go that far. We're trying essentially for the temporary agency to have some accountability for the personnel that they're sending in the short term. So it's a kind of reaction to what was in the paper, but I think we would all like to know that the person who's treating you in a hospital is at least minimally qualified to do what they're going to perform on you.
And I should note that this bill is double referred to B&P,
yes,
and that the amendments will be taken, that the author just accepted will be taken. Yes, Senator Negrete McLeod.
Yes, as the author of AB 1643 in 2001, this bill applied to only long-term care. I'd like to be added as a co-author to this bill.
Without objection, Madam Chair, we'll take the chair of the next committee where I'm going to go as a...
Good. That's just fine. We have a witness in support.
Thank you, Madam Chair and members. Gary Cooper representing AMN Healthcare, and we are the largest temporary healthcare staffing company in the country. And as Senator Wright commented, the LA Times article was very scathing of the industry, and when we looked at that, we were certainly concerned, even though we knew that our members and our employees were not part of that, we were still concerned for the industry. So when Senator Wright asked if we would participate in helping him with a piece of legislation to try to clean up the industry as well as we could, step by step, we certainly said we would do that. We realize that there are fiscal constraints with some of the folks that are going to be involved in this, whether they're the smaller agencies, whether they're the skilled nursing facilities, even the hospitals. We have committed because our standards are very high, and we recognize that we are not involved in some of these activities we're written about in LA Times. We want to make sure that the majority of the industry is as clean as we hope that we maintain that we are. We are working with the Senator. We are working with the different entities, the Hospital Association, the skilled nursing facilities, the smaller temporary staffing agencies. We just want to make sure that we can do the very best to make sure that the folks that are treating us in the hospitals and skilled nursing facilities are the very best health care providers that we can offer. That's why we certainly support this bill. We are not the sponsors, but we certainly strongly support it because we want to make sure that everyone else is doing as good a job as we hope that we're doing. So with that, I would ask for an aye vote, and we will work with VMP and all the other players around the table to make sure that we come up with a good piece of legislation, and I ask for your aye vote.
Anybody else? Anybody in opposition? The bill's been moved by Senator McLeod, Gloria Negrete-McLeod. Secretary, call the roll.
Ask for an aye vote.
Senator Alquist, Strickland, Strickland, aye. Onnested, Cedillo, Cox, Cox, aye. Leno, Leno, aye. Negrete-McLeod, Negrete-McLeod, aye. Pavley, Pavley, aye. Romero, Romero, aye. Senator Alquist, aye. Alquist, aye.
Okay.
Thank you, Madam Chair and members.
Okay. Thank you.
Oh. Members, what I'd like to do is Senator Lowenthal here. I don't see him.
He's on his way.
He's on his way. Okay, what I'd like to do is I'd like to take up one of my bills, which is file item 10, since we have a witness from Santa Clara County, the Medi-Cal bill. Then we'll do Senator Lowenthal, then we'll do both of Senator Cox's bill, and then we will end with my file item 6, SB 1064.
Thank you, Madam Chair. Please open.
Thank you very much, Mr. Chair. This is SB 1236, Medi-Cal Treatment Authorization Request. And we'll begin. The problem is that Santa Clara County, Santa Clara Valley Medical Center, in my district in Santa Clara County, a large public hospital operated by Santa Clara County, is facing lengthy delays in the approval of treatment authorization requests, which we will just call TARS, by the State Department of Healthcare Services. State approval of the TARS is still required even though the county provides the entire match for federal funds under the Medi-Cal program. That means that there is no state general fund at risk. TAR approval by the state is outdated and unnecessary. It was required when state general fund money was used to help pay for the public hospitals. And so what this bill does is eliminates the red tape. And says the bill would exempt Santa Clara Valley Medical Center from having the TARS approved for inpatient Medi-Cal treatment. This will improve the medical center's cash flow and save the state administrative costs. It allows that the county, this exemption, only as long as they continue to provide the match for the federal Medicaid matching funds, meaning as long as there is no state general fund money at risk. Provides that the director of DHCS execute a declaration which will make the provisions of this bill inoperative if and when the county is no longer providing the match for the federal Medicaid funds.
Witnesses in support. Just hit that red button. No.
If you touch
Hit the red button right there. There you go.
Okay, thank you. Trudy Johnson, Interim Executive Director, Santa Clara Valley Medical Center. Thank you for the opportunity to address the committee. I think Senator Alquist really covered the bill quite well. We are currently facing the fact that we only are getting reviews approximately 60 days of the year instead of 156 days of the year, which is significantly reducing our ability to process our TARs and get timely review and cash flow. Given the burdens that we currently have in our own environment, this is really creating an additional burden on the organization. And furthermore, we are really facing a huge volume of the Medi-Cal patients. We see 56% of the Medi-Cal patients in the county of all the 11 hospitals, so we are really carrying the burden here. We have a very strong process in our organization. Currently, we, for our total patient days review, we only have a denial rate of 3.46%. We take our review very seriously, and that we have a very strong quality review process for this, and would implement an even stronger process should we be approved. Thank you.
Other witnesses in support? No.
Madam Chair, and Member Sharita Lane with the California Children's Hospital Association. And while this doesn't affect us specifically, we believe very much that the direction that this bill goes in streamlining the administrative burden in the Medi-Cal program is very positive. Thank you.
Other witnesses support? Opposition?
We request the committee to support an aye.
Okay.
I have a question, Mr. Chairman.
Mr. Cox, Senator Cox.
Let me ask you, Senator, does this bill provide for all other institutions of similar institutions, such as Santa Clara, or is this just a one of a kind of thing to take care of Santa Clara to the detriment of other organizations that might benefit from a similar treatment?
This is not to the detriment of anyone else. Santa Clara Valley Med came to me with the problem because the state is no longer involved in the funding. If other hospitals were to come with the issue, I would be happy to deal with that.
Yes, but are there other hospitals that we could include today in this bill so that everybody in the state of California is treated similarly and fairly?
I'm saying something off the cuff. It's just my own thought here. We've not heard from anyone else. I would be willing to wait a week, and if other hospitals come to us, but I have no way of knowing today if there are other hospitals. And what the bill is doing is not to the detriment of anyone else, because there is no state funding involved.
I understand that part, and that's the reason that you are in the process of granting this provision, is because it doesn't have anything to do with the general fund. I get that.
Yeah.
What I'm simply asking is that we have one large state here. We have 58 counties. I don't know how many other hospitals are in a similar situation. But I do think it would be to the benefit of this legislature to, in fact, look into that particular situation. And, Madam Chair, if it were just a week, I would encourage you to take that, to give you the opportunity and the rest of the state the opportunity to determine whether or not, in fact, this bill ought to be encompass other areas.
Well, I would be happy to put it over, and happy to hear from my colleagues if there are other hospitals facing the situation, because there is no state money involved, and it certainly would expedite the process. So I would be happy to do that, Senator Cox.
Senator Leno had a question.
Mm-hmm.
Thank you. I was going to ask a similar question, just in that we would imagine other designated public hospitals would probably have the same interest as you. So,
in fact, I mean, why don't we just amend the bill and make it statewide and not for one
so
hospital?
under the same provisions.
Yeah.
We'll
just do that today.
The funds. Yes, it's just
Yes.
authorizing.
Right.
Say again, Madam
We
Chair.
will amend the bill so that it's for all hospitals.
That'd be fine.
All public.
Publicly
I'm
designated
told there's
hospitals,
between 22 and 25
Yes,
public
for
hospitals.
all public hospitals.
We certainly ought to give them the opportunity
Yeah,
to
so
participate.
we will not put it over, we will just amend it so that it affects all public hospitals, California public hospitals. Okay?
Well, move as amended, Senator Cox?
Yes.
Move as amended. Any other questions? Okay, the bill's been moved, amended. Secretary, call the roll.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
Aye.
Strickland, aye. Honested? Cedillo? Cox?
Aye.
Cox, aye. Leno? Leno, aye. Negretti McLeod? Negretti McLeod, aye. Pavley? Pavley, aye. Romero? Romero, aye.
Thank you.
Thank you. Senator Lowenthal.
And we'll hold the roll open, yes.
Right,
Thank
and
you.
we'll hold the roll.
Next, we have Senator Lowenthal, file item 9, SB 1169. Welcome.
Thank you, Madam Chair, members. I'm going to accept as author's amendments the committee's suggestion on page 6 of the analysis, which is, and they list the specific places in the bill, which is to maintain the current mental health parity law and to add clarifying language to make sure that any form of treatment limitation or action is subject to the parity requirements. I believe that's what was requested on page 6. In addition to clarifying that any form of treatment limitation is subject to parity requirements, SB 1169 requires health care service plans and health insurers to provide a tracking number for a claim or to a provider's request for treatment authorization. And it also requires that the health care service plans and health insurers provide acknowledgement of a receipt within 3 working days of any requests that they have been asked for in terms of additional information on contested claims. And then we would like all parties to use the tracking number in subsequent communications regarding the claim or request. What that means is that SB 1169 addresses 2 problems. One is that there tend to be more stringent standards for treatment limitations which are applied to mental illnesses relative to other health conditions. For example, plans and insurers require daily prior authorization requests for inpatient psychiatric care, but they don't do the same thing for inpatient with physical conditions. They usually only ask for 1 authorization. They don't require a daily authorization. So we just want to make sure that parity exists. And 2, there are frequently lost claims and slow responses to provider requests for treatment authorization, which can often delay payments, delay authorization, and actually delay the treatment itself. With me today is Randall Hager, President of the California Coalition for Mental Health, the co-sponsors of the bill in support, and to answer any technical questions that you may have.
Thank you. And if I might just take a moment to acknowledge a longtime friend and senior senator from Santa Clara County who had wanted to testify in support in the last bill, Ann Mack. Thank you very much. Thank you very much.
You can testify in support of this bill.
Yes, 2 witnesses in support, 2 minutes each.
Madam Chair, I am Randall Hager. I am the president of the California Coalition for Mental Health. It's 29 organizations representing what we figure are probably roughly 16 million patients, families, providers, institutional, and otherwise. I'm also representing the California Psychiatric Association, and we are co-sponsors of this bill. Heeding your admonition earlier, I'm going to cut to the chase. I'll give you my conclusions, and then if anybody on the committee wants me to develop them, I'll be happy to later. One, in relation to tracking numbers, we've met with plans. We know that they have internal tracking numbers. We're just asking them to share and to give us reasonable acknowledgments when there are claims, when there are requests for authorization, any of the other interactions between plans and providers and or patients. In relation to parity, in 1998, when we first contemplated mental health insurance parity, we basically opened a door to examining additional issues. What we examined at that time were the financial arrangements between individuals and plans, and so co-pays, yearly caps, annual caps on payments for claims were meant to be at parity between health and mental health. And the door that we've opened today really is about the fact that coverages and benefits are certainly the core piece of parity legislation, but there are also other processes like prior authorization, which do need to be brought and emphasized and brought under the parity and clarified that they are part of the parity statute. So with that, I will leave my remarks.
Madam Chair, members, Tim Shannon, representing the California Association of Marriage and Family Therapists. We're part of the coalition which Mr. Hagar represents. I'd like to thank the author, first of all. This is the third year in a row he's carried a bill for us, and we hope to have the same success with this bill as we have the prior two. I just want to speak to the issue of tracking because I understand that there has been some letters of opposition written in that. This is not a revolutionary idea. When you call up a hotel to make a reservation, it's very helpful that they give you a confirmation number right there. If you show up at the doorstep of the hotel and they say, "We never heard from you," you have the confirmation number. And all too frequently this happens when providers are dealing with health plans. It's not a revolutionary idea. UPS uses a tracking device so you can find where the shipment that you ordered is going. Even you legislators use an RN number for legislative counsel. That's how you keep track of the bill drafts you've given to council. The plans say that this would add to some administrative burden to them. We think that is absolutely not the case. There is current regulation which is cited in their letter. I just want to distinguish that. That has to do with claims, first of all, and it doesn't have to do with the unique identifier that a tracking number provides. We're all familiar with tracking numbers. They work. They're not hard to do. And so we urge you to support this bill. Thank you.
Other witnesses, if they could state their name and that they are in support.
Madam Chair, members of the committee, Mary Riemersma, California Association of Marriage and Family Therapists. This bill benefits both consumers and providers, and we urge your support.
Thank you.
Jerry Jeffrey, representing Mental Health Association in California. We are a co-sponsor of the bill.
Thank you.
Amanda Levy, California Psychological Association, in support.
Thank you.
David Vandergriff on behalf of the California Hospital Association, in support.
Thank you.
Teresa Stark, California Medical Association, in support.
Kristen Hare, California Academy of Family Physicians and Osteopathic Physicians and Surgeons of California, in support.
You. Is there other support? Witnesses in opposition?
Madam Chair and members, Maureen Higgins representing America's Health and Insurance Plans in opposition to the bill. My client was pleased to work with the author and sponsors last year on SB 296, which actually required plans and insurers that provide mental health services to issue an ID card with specified information to the enrollee and also to post specified information on the website. Unfortunately, we find ourselves in the position of having to oppose this bill this year, not because of the parity provisions in the bill, but because of the provisions that require the tracking number and the acknowledgement. In regard to the tracking number, all plans and insurers right now assign a unique identifier number for a prior authorization request and for a claims request. So we believe that part of the bill is unnecessary. In terms of acknowledgement, in terms of acknowledgement of claims, the current law already says that if you file an electronic claim, that the plan or insurer must acknowledge that claim within 2 days. If you file a paper claim, it must be acknowledged within 15 days. So we don't understand the need for the additional requirement acknowledgement in this bill, and we think it will actually be confusing if there's an acknowledgement given to an enrollee. The The bill also requires that if you have an incomplete claim and you file supplemental information, the plan would then have to give a secondary acknowledgement within 3 days. To give an example of why these added burdens become unnecessary and burdensome, under this bill, if you had an electronic incomplete claim, under current law you would have to acknowledge in 2 days. This bill would also require you to acknowledge in 3 days. So it's just an example of how when you continue to layer requirements on plans, how it doesn't make sense. 2 final points. In terms of a prior authorization request, current law actually requires a plan to render a decision on that within 5 days. If it's approved, it's typically faxed to the provider. If it's disapproved, it has to be done in writing, and they have to say why.
And in closing?
And in closing, this runs counter to federal health care reform, which is trying to standardize and clarify the claims process, and so this goes counter to that process by adding burdens before that process is finished.
Thank you.
Thank you, Madam Chair. Charles Bakke with the California Association of Health Plans, also in opposition to this bill. I just point out that federal health care reform includes an 85% medical loss ratio for plans in the group market and an 80% MLR for plans in the individual market. As the Chair has authored a bill on this topic as well. This bill is one of many bills this year that will increase our administrative costs in light of this new federal mandate. And if you would, as I was listening to my colleague describe the provisions of existing law, this bill is 28 pages long, about a page of which is actually the new bill. All of the rest of it is timelines and mailing deadlines and notification deadlines that we're required to do. This bill is just adds more complication instead of simplicity to the process and more costs, and for these reasons we're opposed to it. Thank you very much.
Thank you. Others to state your name and your position.
Jason Gappert with the Association of California Life and Health Insurance Companies in opposition.
Thank you. Any other opposition? Comments from committee?
Yes, please.
Okay. Senator Leno.
Thank you, Madam Chair. Actually, this is for any of those who spoke in opposition. The question being that I think, and the author can correct me if I'm wrong, the effort here is to reach parity. And if this isn't the way to do it, can you give us some suggestions?
As you requested, parity portion of the bill, Senator Leno. Actually, with the committee's suggested amendments on the mental health parity provision of the bill, I'm going to have to go back to our council to figure out exactly whether it changes the existing state law in a way that is of concern or not. I'm just not sure with the new language. Our testimony was mostly limited to just the claims handling pieces of the bill, which would apply to everything, not just mental health medical claims. So we're still reviewing the mental health parity provisions, especially with the addition back in of the current language and now this new language being tacked on to it.
Good, thank you.
Senator Lowenthal, would you
Yes,
like,
Senator
would you like to succinctly close?
Yes, I would. I'd just like to respond to just one or two of the comments. I think that what that plans have said is that they have already an internal tracking mechanism. We just think that it would make it much, much clearer if that was just made part of the process for everyone, and that really we do not believe causes any additional cost. And the second part, the reason why we've included the part about providing acknowledgement of a receipt, you know, at that, is that frequently, even though they say, well, we are required to do that, by having this as part of the tracking system and all subsequent communication being part of the tracking system, they cannot say, or they that since it's being part of the track, that they never received it. Frequently what happens is there's all this delay because things get lost. And I'm not saying deliberately things get lost. No one knows. And people just don't know where it is in the system. This will just expedite the process and make it a much more efficient and effective system. And I urge your aye vote.
Thank you. And is there a motion? The bill has been moved by Senator Romero. Call for the vote, please.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
No.
Strickland, no. Honested? Cedillo? Cox?
No.
Cox, no. Leno?
Aye.
Leno, aye. Negretti McLeod? Aye. Negretti McLeod, aye. Pavley? Romero? Aye. Romero, aye. Let's go.
This bill is as amended. There are 5 votes, which is enough to get out. We are, oh, I'm sorry. It only has 4 votes. You're very close, Senator Lowenthal, so we will put it on call.
How close?
You need 1 vote.
Thank you.
Okay, thank you.
Thank you.
And with that, we have Senator Cox. And Senator Cox, thank you for allowing me to present my Santa Clara County bill first. So Senator Cox first has file item 5, which is SB 1063.
Madam Chairperson, if you don't mind, I'll sit here today.
That would be fine, sir.
First, allow me to present author's amendments to SB 1063 that will eliminate Section 2 of this bill. We have passed out mock-ups of these amendments. Madam Chair and members, I believe that it virtually eliminates all opposition to this bill. What remains of SB 1063 will place in statute incentives for enrollees in the Healthy Family Program to utilize emergency and prescription drug services in the most efficient way possible. 1063 will require Mr. MIB to structure co-payments for brand-name prescription drugs at 150% of the copay for all equivalent generic drug, except where no generic is available or the brand-name drug is medically necessary. It also requires the copayment for emergency services to be 150% of the copayment for non-preventive health care services, except in cases where the enrollee is hospitalized. Madam Chair and members, I believe these are common sense incentives to place on Healthy Families Program. I would note that Mr. MIB has already taken these actions administratively, and this bill simply places them in statute. I would ask for your aye vote.
Thank you. Witnesses in support?
Madam Chair and members, Sharita Lane with the California Children's Hospital Association, and the amendments that were referenced have removed our opposition. So we are now neutral on the bill. Thank you.
Beth Capel for Health Access California. We have also removed our opposition with the amendments, and we appreciate them very much.
Crystal Moreno-Lee with Children Now and the 100% Campaign. We'd like to thank Senator Cox for his willingness to work with us to address our concerns on this measure. We feel our concerns have been substantially addressed, and for those reasons, we remove our opposition. Thank you.
It's Don Shinsky on behalf of the California Academy of Family Physicians. We haven't actually seen the amendments yet, but we are, given our understanding what's in them, we are likely to remove our oppose as well. Thank you.
Thank you, Dawn Kapke with McHugh Associates on behalf of the Child Abuse Prevention Center, and also as amended, we believe we'll be removing our opposition as well. Thank you.
Thank you, Madam Chair, members of the committee. Carolyn Gino at the California Medical Association. We as well had concerns with the prior version of the bill, but are awaiting the amendments and will reformulate our position at that time. So neutral at this point. Thank you.
Thank you. Is there opposition? No opposition. The bill has been moved by Senator Grady McLeod and then also Senator Strickland. Were there any comments from the committee? No. Okay. We're ready for the vote. The bill has now been also moved by Senator Leno. It's a very active committee.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
Aye.
Strickland, aye. Honested? Cedillo? Cox?
Aye.
Cox, aye. Leno?
Aye.
Leno, aye. Negrete McLeod? Aye. Negrete McLeod, aye. Pavley? Romero? Aye. Romero, aye. It's got 6.
That bill, Senator, has 6 votes. It has more than enough to get out. We will keep it on call for those who would like to add on.
Thank you.
And your next bill is file item 7, SB 1109.
Madam Chair, I have been here before.
Yes, you have.
I will be relatively brief, but I do, in fact, want to make just a couple of points. I certainly thank you for the opportunity to appear before you today. SB 1109 is intended to redirect and to maximize the Proposition 10 tobacco taxes that were approved by the voters in 1998. Let me call to the committee's attention that Proposition 10 passed with a vote of only 50.50%. It garnered a majority in only 15 of California's 58 counties. You may recall, Madam Chair, that I worked across the aisle last year to advance AB 1422 that was signed into law. That bill helped shore up the California Healthy Families Program. And Madam Chair and members, it did so with Proposition 10, first $5. And just as passing AB 1422 was the right thing to do, we must, Madam Chair, take steps to prioritize the $600 million annual revenue stream that is Proposition 10. And let me repeat the number again. $600 million is the annual revenue stream that is provided by Proposition 10. Madam Chair, we can no longer, and members, we can no longer justify using tax resources for playgroup circle time and movie nights, not when dollars could be used to fund health insurance and direct health-related services. And by the way, Madam Chair and members, I see this effort as very similar to that effort that Senators Kuehl and Ortiz and Runner undertook with respect to bringing accountability to the stem cell agency that was created by initiative. That effort is one that you, Madam Chair, by the way, are continuing relative to providing accountability. I will remind you that the executive director of the First Five Committee of California refused to testify before the Joint Legislative Audit Committee on the advice of counsel. I have previously shared with you press accounts of yoga classes and Italian immersion programs and couples getaway retreats and belly dancing in counties up and down this state. Madam Chair, members, Proposition 10 only requires one county supervisor to serve on each local commission. And last year, in an interview with San Diego County Supervisor Diane Jacobs, she said it was time for a complete house cleaning within the organization. County Supervisor Ron Roberts singled out First Five San Diego as he and his colleagues sliced 771 positions from the county's workforce and a handful of programs that help poor children. He went on to say that the First Five Commission had $200 million in the bank, and he was shocked. Roberts said, "This is not a prudent reserve, this is a sinful reserve, and there's something seriously wrong with the organization." Marion Ashley of the Riverside County said he did not want to serve anymore on a 9-member commission. It's just automatically set up to be dysfunctional, he said about the commission as he was telling the supervisors in a meeting. And Madam Chair, just a few more comments. I've shared with you a summary of the San Francisco supervisors' attendance. If you will take a look at that, for the First Five Commission in San Diego, this is a supervisor that missed 30% of the meetings. And if you will take a look at the attendance record provided by San Francisco, he often attended meetings for only a few minutes. I have shared with you a summary of the attendance of the Riverside County supervisor. Madam Chair and members, Proposition 10 simply did not provide for accountability. Since presenting my bill in special session, I've sent to your offices an updated analysis of the fund balances held by the First Five Commissions, and I have provided for you a copy of the balances today. You know, when we first reviewed the fund balances issue, we looked at the audited financial statements for the year ending June 30th, 2007. Madam Chair and members, it showed an aggregate fund balance of $2.447 billion. And the fund balances from the financial statements from year ended June 30th, 2009, just 2 years later, show about the same number, $2.424 billion. And members, in a time of fiscal crisis and with 2 years of additional security, which the last time I was before you, you said, Dave, stay with it because they will pay attention to the scrutiny. The first 5 commissions only have spent down their reserves by $22.7 million. Barely 1%, Madam Chair, of the total balance. But today I want to raise a new issue with you. I have passed out for your information directly from the Secretary of State's website. I don't think I know, I don't need to tell you what it looks like. It shows that the first 5 Association of California Counties, California, expended a total of $166,000 in political contributions to 2 separate campaign committees opposing Proposition 1D last year. That was nearly 15% of all the funds expended against Proposition 1D. Madam Chair, members, the first 5 association receives its fund in the form of dues from 58 counties of the first 5 commission, and these are dollars that are public funds. Those are funds that could go to the services for California's children. Madam Chair, in closing, let me just say to you that we have 11 years of experience with Proposition 10 and the first 5. You know that First 5 has faced a great deal of criticism, 2 state audits, multiple grand jury reports, numerous media and editorial criticisms. And I would note that the governor's budget proposal includes a proposal to redirect some Proposition 10 funding. I believe this measure that I have proposed is a preferred alternative as it provides funding and solves the ongoing problem with Proposition 10 and the first five commission. Madam Chair, I do in fact just want my colleagues to take a look at the number of dollars that are being held by your respective counties in reserve.
Senator, respectfully, it's been 10 minutes.
Yes, ma'am, and I'm finished.
Thank you so much.
May not be done, Madam Chair, but I'm finished.
Yes, and we understand the difference, so yes, thank you very much. Now, those, first of all, in support of Senator Cox's bill. No one in support. Those in opposition? As always, we do our witnesses 2 minutes each. And welcome to our former State Superintendent of Education, Delaney Ston.
Pleased to be with you.
Madam Chair and members, Sherry Novick with the First 5 Association. We're going to give our entire time to Honorable Delaney Ston. Thank you.
Thank you, Madam Chair and members of the committee. It's a pleasure to be before you today. I am here to oppose Senate Bill 1109 as a very ill-considered initiative to steal money from First 5 of California. There are those who seem to think this work is not essential. I will tell you it is the most important work of our time. The truth is there were some major innovations in this country done by people who didn't have a lot of research. I think of Lincoln starting the land-grant college system. I think of Eisenhower starting a college student loan system. He didn't have research, neither did Lincoln, but we have research. We now know, as a matter of certainty, that the most important developmental time in a child's life is from 0 to 5. The truth be known, there was a recent Economist, January of this year, which said, there is evidence that America and Britain, the countries that combine high female employment with reluctance to involve the state in child care, serve their children especially poorly. A report by UNICEF in 2007 on children in rich countries found that America and Britain had some of the lowest scores for well-being, end quote. One of the little-known facts is that during the Second World War, the United States government actually underwrote child development centers all across the nation. All 48 states had them. Why? Because so many women were in the workforce. And yet the percentage of women working today with children under the age of 5 is far higher than it was during the Second World War. When a child is born, the brain cells are not connected. These brain cells are called neurons, and they need to be connected. When we connect them, we call them synapses, and by age 3, the brain has formed nearly 1,000 trillion of these synapses. For some, those connections, if they're not made when you're 3 or 4 or 5, you can never go back and make them again. The National Research Council said, quote, "From the time of conception to the first day of kindergarten, development proceeds at a pace exceeding that of any other stage of life." I could fill this hearing room with the research and the studies that show us of the value of this education. Indeed and in fact, the attempt to steal this First Five money is especially offensive for me because it comes from people who don't have the courage to raise this tax in the first place. And if you don't have the courage to raise a tax, you ought not to be allowed to steal it. The fact is, the voters said we should do this back in 1998. The tobacco industry came back with Proposition 28 and tried to reverse it by a larger margin the second time the voters were for it.
Would the other witness like to cede her time to the Honorable Easton?
Thank you. The fact is that last May, when the voters were asked about 1D by a 2-to-1 margin nearly, they said no. Look, we know what the research tells us about the importance of this is. The fact is that children have better academic and social skills, a reduced likelihood of being retained, of dropping out, of becoming juvenile delinquents. Children that go to preschool have less of a likelihood of having long periods of unemployment. They are much more likely to stay out of the welfare system, out of the unemployment system, and out of the jail system. The evaluations of our program show that children who have this opportunity have higher IQs. They're more likely to stay academically near grade level, to make normal academic progress. They are less likely to have special education needs. They are more likely to have learning retention, initiative, creativity, and social competency. The public is with us. Some seem to think the public isn't well informed, but they do that at their peril. While the state is filled with terrible cuts to education, please do not insult the voters of California who told you less than a year ago, at great cost, that they didn't want you to do this. This reminds me of that scene in The Wizard of Oz, where the Cowardly Lion turns and says, "Well, I'll get you anyway, Pee-wee," to Toto. Dorothy slaps him. And I think the voters will do the same if you ask them again to take this money away after they so clearly told you 2-to-1 they didn't want you to do that. The theft makes our economic situation worse because, in fact, we do get money from other foundations and from other sources to match the work that we're doing. Last but not least, every county has a board of supervisors that is, in fact, doing this important oversight. It is done all over the state. This is a penny-wise, pound-foolish bill, and I respectfully ask that you reject it. And remember, children are a message we send to a time we will never see. The youngest among us deserve your support.
Senator McLeod.
Thank you, Mr. Chair. I'm not going to be in support of this bill because I know that my counties, and I have meetings with them all the time on First Five, and they've shown me what they've done, and I've also met with my surrounding counties, which is Orange County, Riverside County, LA County, who meet with me regularly to tell me what they're doing. However, I want to thank my friend, Mr. Cox, and colleague, because his doggedness and tenacity has kept this suddenly on the forefront, and where money was being inappropriately used is now going in the right track. And so I want to thank him for his determination of constantly doing this, and that's all I want to say.
Senator Leno. Senator Pavley.
Just a question for clarification, so if I get people asking me about it. The list of campaign contributions as reported from First Five Association to the FPPC, what was the source of those monies, and was that, because it says First Five Association of California, and didn't know if in the ballot initiative itself, as it allows expenditure of those monies for that purpose.
Money that goes to the First Five commissions in the 58 counties comes from Proposition 10,
right?
Which is roughly 50 cents a pack as far as
I know that
tobacco products.
I didn't know if, and I didn't know to just get to the point on whether they could make campaign contributions in supporting or opposing any ballot measures.
May I speak to that, please? I'm the executive director of the association of which Senator Cox speaks. There was not a penny of dues money used in that campaign. The association has many sources of funds. And their dues is one small portion of funds that come to the association. We do many kinds of services with many sources of income, and no tax dollars were spent on the campaign.
So dues means what?
Well, dues are, just like any association,
Yeah.
CSAC or Welfare Directors Association, Public Health Directors Association, members do pay dues to the association to provide services, but the association also does many other services. This is on the website of the Secretary of State because Senator Cox submitted a sworn statement asking the FPPC to investigate the association for its involvement in the campaign, but the basis on which he's made these allegations is specious. There were no tax dollars spent, and I'm very happy to share far more with you.
Yeah, I just wanted some clarification. Is it tobacco dollars?
No, tobacco.
Is it separate money set aside in a special account that people donate to for the purpose of political considerations?
No, we have business income, actually. We provide a lot of services for a variety of organizations. Our association does. So we have income from multiple sources. And I'm really, I'm happy to, it's sort of detailed financials. I'm happy to meet with you and show you. But we actually made a point, no, it is not legal for a public entity to use its dollars to try to influence the electorate. No dollars were used for that purpose.
All right.
I would like to follow up on that. Actually, the old saying is follow the money, but I was not aware of the financial aspect of the PAC. You said dues from businesses.
No.
No, I just want to make it clear. I want to make sure the testimony is clear. Where is the money coming from?
Many different places. The association is an organization. It's a nonprofit organization. That one portion of our budget is from dues that do come from public agencies. However, none of that portion of our budget was spent on the campaign.
Okay.
We provide services. We have service contracts with any number of organizations, and it's essentially business income.
What I'm asking is, where did the money, maybe I'm not hearing you correctly. Okay, I know what it didn't come from. Where did it come from?
We have contracts.
Give me some examples.
Okay, an example would be a nonprofit organization that would hire us to put on a convention or a conference.
Okay.
That would be business income, unrestricted business income.
What's name one of the nonprofits that you did this with?
We have done this before for the California Children and Families Foundation. We have done it for other public entities that have hired us to provide services. I didn't bring that information
so there's
with me.
Public entities, there's no private corporations or private... What I'm getting at is we also have campaign finance limits. Did you get contributions from businesses that would otherwise be under?
We did not collect money. No, we did not collect money for the campaign. We were not a recipient committee. We did not collect money for the campaign. We donated money.
Okay.
And that's the other fallacy, unfortunately, in the sworn claim that Senator Cox chose to submit. He is charging that we were a recipient committee that gathered money for the campaign. We are not. We donated from our fund balance to the campaign.
Okay. Any other questions from committee members? Senator Cox, would you like to close?
Of course. Thank you very much, Mr. Chairman. This is about reprioritizing dollars that come in under Proposition 10. I certainly wouldn't call it stealing, but Senator Easton, you have always been a great speaker. I want to give you credit for that. You have always been a great speaker.
Thank you.
This money would go to healthy families and Medi-Cal with federal matches. I want to make sure everybody understands that.
Senator Cox, can I interrupt you? I was just made aware that some of the testimony, I want you to have the final say in closing. My understanding is some folks want to just say, for the record as an organization, their position. Sure. Sorry about that, Senator. Please.
Thank you, Mr. Chair. Martha Flammer, representing the Los Angeles County Board of Supervisors, and the comments to oppose this measure have been well stated, and the board does oppose this measure.
Thank you.
Thank you.
Thank you.
Mary Jaquish with First 5 San Bernardino in opposition.
Thank you.
Farrah McDade Ting, representing two organizations, the California State Association of Counties and the County Health Executives Association of California, in opposition.
Thank you.
Mr. Chairman, other members, Paul Yoder on behalf of the Boards of Supervisors in Solano and Sonoma Counties in opposition to the
Thank
bill.
you.
Dawn Kapke with McEwen Associates on behalf of the Child Abuse Prevention Center in opposition.
Thank you.
Leticia Alejandres with the California Family Resource Association. We represent 150 community-based family-serving organizations, and we oppose the measure.
Thank you.
Kristen Hare, California Academy of Family Physicians, also in opposition.
Thank you.
Beth Capel for Health Access, also in opposition.
Thank you.
Yes.
Other question? I'm sorry again, Senator.
No, just a very brief comment. In support of First 5, I want to not reiterate, but just to underscore Senator Negrete McLeod's comments. First 5 has benefited the children of San Francisco County extraordinarily, as well as Marin and Sonoma counties. And we have to connect all the dots here. We know, as Delaney Easton shared with us, we know it is scientific fact that children who can benefit from this kind of attention in their first 5 years have a greater chance of succeeding in school and succeeding in life. And we talk a lot about the achievement gap. This is directed specifically at those who are suffering from the achievement gap. And without these services, we have a very greater likelihood, almost certainty, that we will continue to see dropout rates ever higher. And we know that a child who does not complete high school has a 7 times greater likelihood of finding his or her way into our criminal justice system. Then we scratch our heads, why is the Department of Corrections growing faster than our investments in higher education? We need to invest in our children early, or we'll pay for it at a much greater expense later. Human expense and dollars as well. So I appreciate Senator Cox's efforts to make sure that we spend these dollars according to the will of the voters. And yes, the auditor found an error here or a discrepancy there, but that is not reason to eliminate a statewide program that is helping children who need help the most. So I will be opposing the bill today.
Senator Cox, you may close. Thank you.
I would encourage Senator Leno to read the audits. But having said that, let me just say to you that this money goes to healthy families and goes to Medi-Cal with federal matches. And members, Mr. Chairman, if kids don't have health care, the music circus or the play groups won't make much difference. I appreciate Senator Easton's comments. She's a great speaker. But let me just tell you that $2.4 billion in reserve, not going to all the good things that for whatever reason, you think are occurring. And we've done our best to try to call this to the attention of this committee, and I appreciate the fact that there are those that it wouldn't make any difference as to what has been said, simply not going to change your mind. But at any rate, I would ask for your aye vote.
Bill's been moved by Senator Cox. Secretary, open the roll.
Senator Alquist, Strickland?
No.
Strickland, no. Onnested? Cedillo? Cox?
Aye.
Cox, aye. Leno? Leno, no. Negrete McLeod? Negrete McLeod, no. Pavley? Pavley, no. Romero? It's got one aye vote.
That bill will remain on call, Senator Cox.
Well, let's do 2 out of 3, Mr. Chairman.
Okay.
I said a vote for your other bill.
What's that?
I said I'm voting for your other bill.
Senator Leno, my understanding is you're going to present on behalf of Senator Yee. Thanks. Members, this is file on 1 SB 880 by Senator Yee, presented by Senator Leno. Senator Leno, you may open.
Because you're going to need to get Bill Cedillo. My pleasure. Thank you, Mr. Chair. The bill is very straightforward. All it does is establishes a mandatory requirement to wear helmets for skiers and snowboarders under the age of 18. identical to the requirement that we have for children under the age of 18 when operating a bicycle. And the fine would be the same, not more than $25 on the parents of a child who fails to wear the helmet while skiing or snowboarding. And as you'll hear from the supporters, this can be a life or death matter. Half of all skiing deaths are caused by a head injury. And recent studies show that when helmets are used, the incidence of traumatic brain or head injury has been reduced dramatically. So we can save lives. In fact, a study shows that more than 7,000 head injuries per year on the slopes could be prevented or reduced in severity by the use of a helmet. And injuries that are sustained without a helmet are not only dangerous but also pose significant financial hardship. Enactment of this bill will decrease the number of serious injuries, thereby reducing health care premiums for everyone. So I would ask for your aye vote.
Senator Leno, my understanding from staff is that the committee's recommendations, my understanding is authors willing to take those amendments, and that I believe there's some additional amendments. Is this the additional? Okay. The additional amendments would be to remove the requirement that any snow sport helmet offered for sale be labeled to certify that it conforms to specified helmet standards.
Yes, that's correct.
Okay. And the other one is remove the prohibition against selling snow sports helmets that do not conform to specific helmet safety standards.
That is correct.
Okay. Thank you. Witnesses, please, in support.
Amanda Levy on behalf of the California Psychological Association, sponsors of Senate Bill 880. I have with me today Dr. David Lechuga, neuropsychologist, past president of our association and chair of our Division of Neuropsychology, to present. Thank you.
Thank you very much for allowing me to speak.
Do you want to push your red button? There you go.
On a day-to-day basis, I see patients who have head and brain injuries as a result of trauma. And this bill was conceived after seeing patients like this for approximately 25 years. Actually, it was conceived with a patient of mine, a fellow by the name of Jason Brown. And after researching this for a number of years, I just felt compelled to step forward and bring to the legislature some sort of change that would reduce the suffering and reduce the death associated with unnecessary trauma to the brain. So I just wanted to let you know that as a treating doctor of these individuals, I can tell you very clearly there's a very different outcome from individuals who wear a helmet when they're skiing or snowboarding and sustain a head or brain injury versus those who do not. Those who do wear a helmet half the time do not sustain a significant head injury. Those who wear a helmet and sustain a head injury have a decreased morbidity. That is, they are out of the hospital sooner, they have lower costs associated with their care, and they have less suffering. And I think what we know is that their family also suffers less because the burden is now minimized after this type of trauma. So I understand there's some logistical issues in terms of enforcement and just placement of signs, all of that, but I think there's a compelling public health issue which I'd ask you to consider and to vote favorably for this bill. Thank you.
Thank you. I'm Shelby Ganich, and I'm a survivor. On March 2nd, 1999, I was snowboarding, and I was going off a jump, a small jump, probably about a foot in the air, and I was going too slow. So in the air, my board went straight down and knocked me unconscious. I wasn't breathing. My body started posturing. I was dying. A ski patrol expert got to me and took me down to the bottom where the ambulance and the helicopter were waiting, and they intubated me, giving me airways so I could breathe. And they airlifted me to the county hospital, and I was in a coma for 3.5 weeks on life support, not expected to live. My parents were told to prepare for the worst. And when I did wake up, my left side of my body was paralyzed. And I was in the hospital for 3 months. And I was 18, and I had to learn how to walk, talk, do everything, care for myself, write, everything all over again. I went to therapy, outpatient therapy, for a year after that, and worked on those things, as well as my speech. My vocal cords were damaged. After that, the therapy did not stop when I got out of that, my outpatient therapy. I did pool therapy every day. I did Tai Chi and acupuncture. I had a massage therapist. I had a personal trainer at the gym, a nutritionist, and therapeutic horseback riding. All of this because I had nerve damage on my left side, permanent. So my parents tried everything to help me. Excuse me. Okay. So all of this, I wasn't wearing a helmet, but in retrospect, had I been wearing a helmet, doctor said my injury would have been a lot worse than it was because I wasn't wearing a helmet. So I speak at schools, primary and secondary schools now, and I've spoken at Snow Summit, Ski Patrol during Safety Week, showing my support and expressing how important I think it is to wear a helmet and how necessary. And I'm so happy to be here today sharing my experience, and hopefully we can make a difference and save lives. Thank you.
Oh, me. Hello, my name is Nina Oboldia, and I support Senate Bill 880 because about 3 years ago, I was snowboarding with my cousin and sister on a bunny hill. I was ahead when my snowboard hit a chunk of ice. I fell back. I was out for maybe a minute to 3 minutes. Then I was greeted by my cousin and sister. Then the North Star Hospital came. They did some tests, like with the eyes. And then they took me away in like a bed sled. The reason exactly why I support the bill is because if I was not wearing a helmet, the doctor said I could have had serious long consequences, like not being able to go to regular school. The reason exactly why I think we should all be able to wear, we should all have a helmet is because, like Mark Leno said, was that most injuries on slopes is caused because kids are not wearing a helmet. So, thank you.
If others could just say their name and that they are in support, please.
Tim Shannon, representing the California Orthopedic Association and the Children's Specialty Care Coalition, in support.
Charlotte Newhart with the California Foundation for Independent Living Centers, in support of some of the money goes to the Traumatic Brain Injury Fund in California.
Randall Hager, representing the California Psychiatric Association, we're in strong support.
Connie Delgado Alvarez with the California Hospital Association, in support.
Paula Dowdis, Administrative Director of the California Brain Injury Association, in support.
Sharita Lane, California Children's Hospital Association, in support.
Teresa Stark, California Medical Association, in support.
Mike Dillon, representing the California Ski Industry Association, in support, and we appreciate Senator Yee and his staff working with us on amendments to get us to this position. Thank you, Madam Chair.
Tim Madden, representing the California chapter of the American College of Emergency Physicians, in support.
Thank you.
Mark Segman, Association of California Insurance Companies, in support.
Has there been a motion? Witnesses in opposition. Any comments from the committee? Is there a motion on the bill? It has been moved by Senator Pavley. Call for the vote, please.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
No.
Strickland, no. Honested? Cedillo? Cox? Cox? Aye. Leno?
Aye.
Leno, aye. Negretti McLeod? Negretti McLeod, aye. Pavley? Pavley, aye. Romero?
That bill has 5 votes, which is enough to get out. We will keep it on call. Thank you.
Thank you very much.
Last bill we have is the Chairwoman's Bill SB 1064. Madam Chair, you may open.
Thank you, Mr. Chair. Thank you, Mr. Chair. In 2004, California voters approved Proposition 71. The California Institute of Regenerative Medicine, which I will call CIRM, received authority by Prop 71 to invest in stem cell research on behalf of the state. Prop 71 passed at a time when the federal government severely restricted funding to embryonic stem cell research. Prop 71 was seen by some as a way to circumvent the strict federal requirements that were in place then on embryonic stem cell research. This investment, passed by the voters, will cost the public $6 billion in taxpayer money when you factor in the cost of paying off the bond. That's $6 billion to be paid by taxpayers. Prop 71 promised to establish a world-class institute, CIRM, to provide grants and loans for stem cell research. Many therapies developed with taxpayer money available to low-income and to provide with taxpayer money available to low-income and uninsured these therapies, and to benefit Californians in the state both indirectly through creation of jobs and directly by sharing with California revenues generated as a result of this investment. CIRM needs to deliver on these promises, and the legislature should do all it can to ensure that this happens. In fact, CIRM should be a partner with the state, and in many ways it is. It needs to be a partner with the state since they are receiving taxpayer money that could be going for other important things, certainly during these times when we look at the cost of health care, of education, public safety, and many other areas that we care about. I'd like to talk a little bit about prior legislation because it's sort of a fuzzy area and we need to be clear about this. There have been no bills passed on CIRM, although many attempts have been tried, including by the last two chairs, Senator Ortiz and Senator Kuehl, chairs of the previous Senate Health Committees. And all of those bills were before we got the Little Hoover Commission report. The Little Hoover report came because Senator Kuehl and Senator Runner requested the Commission to look at the governance structures of the ICOC and CIRM. And the Commission, the Little Hoover Commission, identified a number of problems with the governance structures. There have been two resolutions, only two resolutions on this topic. One requesting a study and one urging CIRM to adopt policies around conflict of interest and open meetings. This legislation, SB 1064, unlike prior legislation, has the benefit of the report, the Little Hoover Commission report, and seeks to implement some of their recommendation. Beyond what's in Prop 71, CIRM has taken some steps to provide for oversight and transparency and to provide, in return to Californians, this through internal regulations, and we appreciate that they have done this much. However, we know regulations can disappear at any time given the leadership of CIRM. Concerns about transparency and oversight continue to be raised by the public, by the Independent Citizens Financial Accountability Oversight Committee, CFAOC, as well as the Little Hoover Commission and the State Controller. What I'm trying to do, and why I have authored SB 1064, is to put into law good practices that currently exist in CIRM regulations. Regulations that CIRM has figured out and decided on its own. I want to see that when there's a change in leadership, whether it's a change in this coming year when the current chair steps down, or whether it's a change 10 years from now, that these regulations are codified into law. And we do expect a change in the leadership for the chair at the end of the year. The bill is 70% about codifying these regulations into law, and I simply don't understand why CIRM is opposed to a bill that takes their good regulations and just wants to see that they are law for future generations future generations. Also, SB 1064 implements recommendations from the Little Hoover Commission to increase transparency and oversight to ensure CIRM is not continually distracted by public concerns from its missions. And I want to be really clear, because you may hear otherwise on this point, but there is nothing in this legislation that would impinge on CIRM's ability to make grants and loans. It is not my intent to stop or reduce the ability of CIRM to make grants. We all understand that is really important, and I was very pleased to be a very early supporter of CIRM when it was on the ballot. This bill ensures that California receives direct benefits from its investment in stem cell research by requiring all revenues from intellectual property agreements to go into the general fund. And this is already a requirement in CIRM regulations. That is what they are already doing. An important distinction: in intellectual property refers to ownership of royalties, patents, licensing fees, and stock warrants. This does not include any proprietary information of the research. There is no requirement of this bill to disclose any such proprietary research information. This does not jeopardize the important science work that CIRM is doing. We are only talking about who owns what portion of revenue rights when these drugs become a blockbuster and who makes a lot of money. Prop 71 clearly says that the state shall benefit from, quote, royalties, patents, and licensing fees, unquote, but leaves unclear the mechanism. This bill doesn't tell CIRM how to structure IP intellectual property agreements, but simply meets voter intent in the initiative by ensuring when there are revenues that a portion of that be shared with the state. I mean, after all, the taxpayers are paying $6 billion. This is especially important during this fiscal crisis the state is facing, and we hope it won't happen again, but the economy is always cyclical, so that we will be protected in the present and in the future. We are not asking for all of the revenues, we're just asking for a portion. And we give CIRM the latitude to determine what the portion should be. How reasonable can you get? And to ensure that private partnerships can occur to bring drugs to the market. I don't understand how anyone could object to ensuring a portion of the revenue come back to California and the taxpayers who are paying the $6 billion for CIRM. And this was a promise that CIRM made to the voters, that we would see a return on the investment. Okay, so there are also, the bill enacts two other requirements in existing CIRM regulations requiring affordable access to drugs developed with Prop 71 funding by doing some things, requiring CIRM grantees to submit plans to provide low-income and uninsured Californians access to drugs that are entirely or partly a result of CIRM-supported research, and requiring grantees. Now remember, this is already in CIRM regulations, requiring grantees to provide drugs to state and local government-funded programs at one of three benchmark prices in the California Discount Prescription Drug Program. CIRM currently has regulations on access to therapies funded with Prop 71 dollars. However, these regulations can change with leadership. SB 1064 will codify those regulations which require that pharmaceutical companies make drugs available at one of three discount prices. Why is this important? To ensure that all Californians have access to therapies developed with public funds regardless of insurance status. I don't understand why anyone would be against that. Obviously, CIRM recognized these requirements to be important, otherwise they would not have put them into CIRM regulations. And clearly these requirements are important and should be protected in statute. Now, in addition to codifying CIRM regulations, I'd like to explain what the new pieces that are not in CIRM regulations are of this bill. This bill also includes recommendations made by the Little Hoover Commission intended to improve transparency, accountability, and oversight. It clarifies the roles and responsibilities between the board chair and president, ensuring that appropriate checks and balances exist within CIRM and its governing board. The bill requires CIRM to create a succession plan for changes in leadership and a transition plan for the end of bond funding, which certainly affects the state, and that occurs in 2014. CIRM has been issuing grants and loans for 5 of the 10 years that the bond was authorized for. We should take steps to ensure that CIRM maintains momentum when there is a transition in leadership and when the bond funding expires, and both of those things are going to happen quickly. SB 1064 also deletes the 50-employee cap and 15 scientists cap on peer review, enabling CIRM to process grants quicker. There are many provisions on oversight and accountability, and I'd like to speak to one in particular that I believe that is needed, and that is performance audits for CIRM. Prop 71 only called for financial audits. There are no regular performance audits. And I think many of us understand that performance is tied directly to finances. Performance auditing will assess CIRM's operations, its policies and procedures, its use of resources to ensure that Californians are getting the best return on their investment. The bill even takes steps to ensure that performance audits do not impinge on CIRM's right to make scientific judgments. So why are performance audits needed? CIRM uses significant resources on internal and external PR, communications, and lobbying as part of its effort to improve its public image. In 2009 alone, a year when it had no lawsuits, CIRM spent $1.5 million on external lobbying, PR, and communications contracts, and thousands more on internally in these areas. CIRM has indicated their intent to spend potentially upwards of $1 million this year in a PR campaign to change its public image. Now, I have not been told that directly. I was told that by my staff, and someone from CIRM may wish to comment on that. But I will say to spend $1.5 million last year, and if it is true, the $1 million for the coming year to improve its image, I'd say, well, why does it need to improve its image? And also, this is not a good use of public resources. Next, CIRM executives are also paid exorbitant salaries that match the very highest in the UC system. The director of CIRM makes almost $500,000 compared to the director of the NIH and the director of the CDC, who make $300,000 less. And they manage significantly larger programs. The vice chair of CIRM's governing board was originally an unpaid position. When the current vice chair took office, he was paid $75,000 for half-time. Within 1 year, his salary was raised to $275,000 for 80% time. And at a point when the state made massive cuts and implemented furloughs, this is what CIRM was doing with its public investment. When news around these abuses surface, we have to address the issues through performance audits, not just fiscal audits, but through performance audits, we can determine if CIRM is using its resources appropriately and efficiently. If public concerns were met, this would free up millions of dollars that CIRM has that could be invested in stem cell research. Changes should be made to increase transparency and oversight and to improve workflow efficiency. Cost of funding. Currently, it costs the general fund $100 million each year to service the bond debt. In 2014, when the bonds have been spent, the cost of servicing the principal and interest each year from the general funds will be over $200 million. When you spend that much money from the general fund, you want to be sure that the public is getting its direct benefit from it. I'd also like to say I do not wish to interfere with what the ICOC and CIRM does well, nor would the law allow me to. I want to respond to Prop 71, to the people of California, and to CIRM. I want to be responsive, and for these reasons, I took amendments to the bill that do three things, basically. One, to specify that deference should be given to scientific judgment during audits. Lawyers pointed out that it was difficult for non-experts to review scientific judgment and that they planned to look at their science. Upon reflection, I agreed, and I made the change. Second point, to allow for the pre-screen of applications for completeness and program requirements. Lawyers pointed out that it was difficult to have the working group process all applications. Upon reflection, I agreed and made the change with protections against any conflict of interest. The third point, I had wanted originally to do performance audits every year. Lawyers pointed out that it was difficult to undergo an audit and implement its findings in a single year. Upon reflection, I agreed and made the change that performance audits will happen every 3 years. While we do not want to see CIRM or the ICOC overburdened, we need to address their failings and to codify their best practices, and they have many, which I have already spoken to. For example, Prop 71 and CIRM's own internal regulations have requirements around proxy voting to ensure that proxy voting is only used occasionally. In an analysis of the last 24 most recent governing board meetings, we found that this is common practice, with one board member using proxy voting 75% of the time. This issue alone reinforces the need for greater openness, and particularly the requirement that statute, not just regulation, but statute, require that individual votes and recusals be listed. It is not meddling, members, to ask that the ICOC and CIRM follow statutes. I do not wish to overburden CIRM, and that is why I amended my bill in response to their legitimate concerns when they met with my staff and with their lawyers. I would be happy to work with CIRM to address their concerns, but they so far have basically said they don't want to work with me on this legislation. There have been 2 other chairs of previous health committees who have tried very hard to do this. I'm doing my darndest to see that it's thorough, that it's fair, and that we have something in law so that we know for the future, for our children, for our grandchildren, for our neighbors, for our families, for our communities, to see that the investment in the $6 billion that the taxpayers have made, that we will get back in a fair manner. Thank you.
Witnesses in support.
Good afternoon, members of the committee, Madam Chair. My name is Stuart Drown. I'm the Executive Director of the Little Hoover Commission. It's an independent bipartisan panel that looks at the performance of executive branch agencies. The Commission supports Senate Bill 1064 based on the recommendations the Commission made in its report last year to improve the transparency and accountability of the State Stem Cell Institute. In 2008, members of the Senate Health Committee, Senators Kuehl and Runner, asked the Commission to study the Stem Cell Agency to make recommendations to strengthen its government structure to propel CIRM's success. The Commission spent the greater part of a year holding hearings, attending CIRM meetings, interviewing dozens of stakeholders inside and outside CIRM. What the Commission found was an agency that was in transition, and this is a transition that was made more complicated by an outdated governance structure that they were locked into by Proposition 71. The agency has quickly moved from its startup phase to an operational phase, and now is halfway through the 10-year experiment that was laid out by the proposition. It remains unclear what will happen to the taxpayer's $6 billion investment once the bond funds expire. Will the agency cease to exist, or does it position itself toward permanency? We found that these are the questions that CIRM needs to be asking itself in a public way, and increased oversight will help this process. Senate Bill 1064 implements several key Commission recommendations, and in doing so takes important steps towards improving the governance and oversight of CIRM. Number one, it requires CIRM to lay out its future plans, including a transition plan if the bond funds or when the bond funds expire. It requires CIRM to develop a succession plan in anticipation of the day that its founding chairman steps down. It clarifies the role of the CIRM governing board, that the board, the Independent Citizens Oversight Committee, that it should be appropriately focused on oversight and leave administrative functions to the CIRM staff. And it strengthens...
In conclusion?
Well, we like to say that it also improves the position of the Citizens Financial Accounting Oversight Committee to do the kind of performance work that it can do, the performance oversight. So we urge your aye vote.
Thank you.
Good afternoon, Madam Chair.
Please be
and
brief.
members.
We've had a good opening from the chair, so thank you.
Good afternoon, Madam Chair and members. I'm Ruth Holton Hodson, Deputy State Controller and staff of the Citizens Financial Accountability and Oversight Commission, chaired by State Controller John Chung. And we're here today to strongly support 1064. I'd like to just take a quick moment. CFAOC's audit authority is limited to reviewing the independent annual financial audit commissioned by CIRM. The purpose of the audit is to ascertain whether CIRM is following generally accepted accounting principles. It is not a detailed analysis of CIRM's expenditures or the appropriateness of those expenditures. As the state's chief fiscal officer and chair of CFAOC, Controller Chung is committed to CIRM reaching its highest potential with full public transparency and the guarantee that the benefits from the taxpayer's $6 billion expenditure do indeed go to the people of California as promised by Prop 71. We urge your support. Thank you.
Thank you.
Beth Capel on behalf of Health Access, here in support particularly of the provision providing free or low-cost drugs to the uninsured. Thank you.
Thank you. Witnesses opposition.
And Senator Strickland, I'd like to add that the point that I made that the vice chair's salary was $275,000 for 80% time came directly out of the Sacramento Bee. The Stem Cell Agency triples Leader Torres' salary December 11th, 2009. And that I will also take the amendment to do the performance audit every 3 years.
All right. Wonderful. Thank you. Witnesses opposition.
Good afternoon. James Harrison on behalf of the California Institute for Regenerative Medicine. First, if I could, I'd like to explain what the position of CIRM is and then briefly respond to some of the points that Senator Ahlquist made. Very well. Thank you. Let me proceed then to address some of the points that Senator Ahlquist made. She made the point that SB 1064, in fact, codifies many actions that CIRM has already undertaken and puts them into regulations. And she argued that regulations disappear and therefore it's necessary to put these measures into law. Of course, CIRM is subject to the Administrative Procedure Act. Any change to these regulations would be subject to public hearings and ultimately approval by the Office of Administrative Law. Second, CIRM does not object to the state obtaining a return on its investment. In fact, as Senator Ahlquist noted, CIRM regulations already require that any return on CIRM-funded research through intellectual property revenues go to the state general fund. What we object to is the inflexibility of the regulations in particular areas, and let me give you an example. Currently, CIRM is required to balance the need to ensure that its intellectual property regulations don't unnecessarily hinder the research with the need to ensure that the state has an opportunity to earn a return on its investment. CIRM has struck that balance through regulations that require access plans for the uninsured and CalRx pricing for government-funded programs. However, as we all know, we live in times when the healthcare landscape is changing dramatically as we speak, and CIRM needs the flexibility to alter those regulations if the balance it struck turns out to be wrong. Our goal is to provide therapies and cures to the patients of California, and if the board determines that the regulations stand in the way of delivering those therapies and cures, then CIRM will not be able to meet its mission that the voters of California entrusted to it. Finally, let me briefly respond to the point made about Senator Torres' salary. In fact, Senator Torres' salary is $225,000, and if you take account of the fact that he had to forego his pension to take this position and that he does not receive health care insurance, it's really closer to $165,000. Thank you.
Other witnesses, opposition.
Mr. Chair and members, I'm Michael Hawkins. I'm here on behalf of CHI, the California Healthcare Institute. That is the association that represents the 270 life science, biomedical, and device manufacturers in California that actually take this intellectual property that's developed on behalf of the state and developed into the medicines and the devices that the patients of California need. First of all, before my specific comments, let me just make one comment. If this bill was just about accountability, I would not be here. My comments are going to be about how this disincentivizes the companies that CHI represents from entering into these relationships. The fundamental purpose of Prop 71 was, quote, to improve the healthcare system and reduce the long-term healthcare cost burden on California by developing therapies that treat diseases and injuries with the ultimate goal to cure them. This assumes that Serum-funded research will go directly to address these goals. We're concerned that the pricing and access requirements in the bill undermine the healthcare goals of Prop 71. The basic goal of intellectual property policy should be to minimize barriers to transferring technologies from basic research laboratories to the private sector. And that's the key here. The basic goal of intellectual property policy should be to minimize barriers to transferring technologies from basic research to the private sector. That's exactly what takes place when the Genentechs of the world, the small biomedical companies, take the basic research and turn it into technologies that can result in medicines. Without industry participation, basic science cannot be developed. I will tell you how it interferes with that.
That's a very important part. So.
Okay, investment in biotechnology is inherently very risky. Takes from 10 to 15 years to develop it. Any aspect of technology transfer contract that increases risk, particularly by adding an element of uncertainty, makes it less attractive to potential partners and investors, and thus reduces the prospect of successful commercial collaboration. This is how the bill does it. This bill would discourage commercial collaboration, technology transfer, and licensing by reducing the rate of return on serum-related deals in comparison to other academically related transactions, and increasing investor risk by promoting state policy governing downstream products. Okay. The way it does that is, as the senator alluded to, that they have to meet certain prices at certain times. How can a business have any assurance and any predictability 10 to 15 years down the road when they're taking basic research that they don't know is going to result in a product? And if it does, you hear about the blockbusters. There are many that don't come through. So what this bill does basically is it disincentivizes the industry and puts enough risk there where we think, will it all go away? No. Will a significant amount go away? We think yes, because the investors in these markets are very sensitive to the fact that there's high risk. Let me close. We believe that codifying IP provisions in statute will deny the ICOC the flexibility it may need to amend these IP policies in the event they prove to be inadequate. And by codifying that, you take away their flexibility. I would suggest that the legislature keep a close watch on Serum, and if Serum starts changing the regulations that you wish to codify and think it is not appropriate, then take action. Serum has just begun to issue research grants, and it will likely be several years before any discoveries from this research move to commercialization stage. Thus, the ICOC may not know for some time whether the IP policies it has adopted are effective, and it will need flexibility to change its IP policies as the situation warrants. CHI and the biomedical community support the goals of Serum to invest in promising research that can be commercialized, creating therapies and medicines that will benefit patients. We strongly believe that industry participation is critical to this success, and we strongly believe that this bill will disincentivize that, and for those reasons we're opposing it. The final point is, if this is only about accountability, I wouldn't be here, and transparency.
For identification purposes only, because we've covered the time allotment for opposition.
I'm Don Reed, the co-chair of Californians for Cures, father of Roman Reed, paralyzed young man who was the source of the Roman Reed Spinal Cord Injury Research Act. Strong opposition.
Ma'am.
Judy Robertson, on behalf of 15,000 Californians with Huntington's disease. We strongly oppose.
Thank you. Questions from committee members? Anything? Senator Pavley.
I don't think there's anyone up here who doesn't support the mission of CRIM. Maybe you could explain for me one more time, other than the desire for flexibility, why we shouldn't be providing the oversight and requiring, codifying the regulations and putting them in statute, because if you could also address, I'm concerned about the perceived or real conflict of interest of how monies and grants are sent. And these are, I just feel as a legislature, it's really important to monitor carefully any bonds that require expenditures from the general funds to pay the debt service. The public expects me to ask those questions and make sure that there are no problems with how you expend $6 billion worth of money.
So my understanding, Senator Pavley, would that be a motion to move the bill?
Well, I wanted to answer questions, or Senator Alquist can do that in her close or whatever, or through them. Just on the conflict of interest in particular, why I get a lot of questions about conflict of interest, real or perceived, and why there shouldn't be a clear barrier and protections on that, and a lot of transparency, and why wouldn't we want to put in statute the very regulations and codify them that they've adopted? It doesn't make sense to me, other than supposed need for flexibility.
Who would like to answer that?
If I could respond to that, and I'll take them in reverse order if that's okay. With respect to the conflicts of interest, CRM, like other state agencies, is governed by the Political Reform Act and Government Code Section 1090. So all of the members of the board, for example, who have an interest in an application, recuse themselves from participating in any discussion or consideration of that application. And with respect to transparency, all of those vote tallies on each application that comes before the board are appended to the minutes of the board meetings. Transcripts of the meetings are also available on the agency's website. So any member of the public has the ability to look to see what the conflicts of interest were and who recused themselves from participating. With respect to members of CRM's working groups, the controller has conducted an audit of the agency's compliance with its conflict rules and determined that in some cases our rules go further even than those of the NIH, and that CRM has in fact complied with its conflict rules. With respect to the regulations, our concern is specifically with respect to the intellectual property regulations, the access and the pricing. And the reason for that is, as my colleague explained, is that in order to bring these therapies to the market, ultimately CRM needs the participation of industry. And one of the reasons that Proposition 71 was designed in the way it was to give the board the power to adjust to changing circumstances. So if there is some intellectual property regulation that is actually impeding the agency from achieving its goals of providing therapies and cures to the public, we can address that through public meetings, through an open process, with input, and with the approval of the Office of Administrative Law. We believe that that flexibility is critical because this is a very new area of medical research. Therapies have not yet reached the marketplace. We can't predict everything that will occur. And furthermore, we're in a time when the healthcare landscape itself is literally changing as we speak. So we think it's very important that the agency maintain the flexibility to deal with those changed circumstances if they arise and if they impede the agency's ability to meet its mission.
And you haven't had the ability to work with the senator resolving some of those areas of conflict?
We have met with the senator's staff and addressed these issues, and we would welcome the opportunity to continue to work with her. One of the things that we've suggested is that if this bill were to go to interim hearing, it would give us an opportunity to more fully explore those issues, and it would give the legislature an opportunity to provide the kind of oversight that you had mentioned.
Senator Anistad.
don't think we have to wait till an interim hearing, though. We still have many months to go left in this session. Mr. Hawkins, you raise really the only concern that I have with the bill so far. And to the Senator, I'm going to vote for the bill today and urge my fellow Republicans to vote for the bill. And I heard you when you said that you weren't getting the best cooperation from CIRM on the details or the final outcome. I think as this bill goes through the committee today, you'll have a chance. I think it goes to appropriations next, and then it'll actually have to go to the floor at some point in time. You know, I may vote differently at that time, but I think there's certainly enough time where you could lock yourself in the room with the senator and in an hour come up with the language that would satisfy both of you. My concern is the intellectual properties and wanting companies to take the risk and be involved, but I also read the language of the initiative of itself, which mandates that, but it also said there has to be a return to the taxpayer. It doesn't seem like it'd be inventing, you know, something really hard. This is something that could be solved in an afternoon if you really sat down and talked to the senator about it. So I'm hoping that we'll have a bill on the floor that everybody can support. Otherwise, you know, we'll just have to reserve our vote for, you know, whether it's a good bill or not in the end. And, you know, whether you folks are at the table or not, she has the ability to change the bill anyway in any time she wants. So it's really up to you to give her a solution to this, I think.
Senator Alquist, would you like to close?
I would, and I would like to address certain comments. On the conflict of interest, Senator Pavley, our bill specifically simply addresses it in the pre-application area. CIRM has certainly, with comment over the years, that is one area where they have improved their process. What was your other question?
It related to codifying the regulations they've adopted, put in statutes, but it triggers what Dr. Aniston was talking about on protection of intellectual properties, and I followed up asking if they would work with you, and they suggested.
Well, as I have several points I need to respond to. One very important one is the difference between intellectual property, IP, and proprietary information. What we are asking for is intellectual property, which refers to ownership of royalties, patents, licensing fees, and stock warrants. We want to know who owns what. That does not jeopardize scientific investigation. The next point that I'd like to make, it was mentioned by the opposition that it would be easy to change things down the line. Well, it wouldn't be for a couple of reasons. One, just even in changing regulations, the Administrative Office of the Law looks to see if regulations are good. It doesn't look to see if regulations are good or bad. It just looks to see if the process is followed. And the second thing, real clearly to say, the 1,000-pound elephant in the room, is that this bill is going to take, should it get out of the various committees, it would take a 70% vote in each house. And I don't think I've ever seen a bill lobbied against so hard as this one. I'd like to address Senator Onestad's comments in that from day one, we had the chair of the board, the president of the board, their legal representation with me and my staff in my office for about 2.5 hours to explain the main tenets of the bill. And I said how much I wanted to work with them. My staff has gone to San Francisco and has been told by CIRM, we will listen, but we will not take a position, we'll not try and make it a better bill. I have tried very hard to work with them. It has been like a stone wall. And couple things in closing, and I will close now. I mean, we've really talked about this thoroughly, is that there has not been legislation, there has not been a bill signed into law that deals with these issues. And I don't understand why CIRM is fighting putting one of their regulations into statute to say revenue should go to the general fund. That was the commitment made by CIRM in the initiative. Now, if private industry wanted to do it completely their way, they should have paid the $6 billion, not come to the people of California. But the taxpayers voted for this because they wanted some return on the investment. It was a commitment CIRM made. It's a commitment I think CIRM should follow, and I ask for your support.
I'll move the bill.
The bill's been moved by Senator Pavley. Secretary, please call the roll.
Senator Alquist?
Aye.
Alquist, aye. Strickland? Strickland, aye. Onnested? Onnested, aye. Cedillo? Cox? Leno?
Aye.
Leno, aye. Negretti McLeod? Pavley?
Aye.
Pavley, aye. Romero?
And if you could hold it open.
The bill has 5 votes, and we'll hold it open.
Thank you. Okay, where's Senator Negretti McLeod?
So this is not my area. I'm the only one here, so I just...
In 2 minutes? Thank you.
It was long enough. No, but Sam's point on sit down and work with him, because we're going to pass it. Because he hasn't worked with me. Because they've been opposed to them.
No, the rules are... Dr. Onestad was here, he went straight right there.
More than a gift. And it was in the initiative to pay it back. This was not like us grabbing money for need money.
Were there any...
What
can be done by 70%?
No, but Elaine brought up that it 70%.
So some of this has to go back to code.
No, I think they realized they were good systems on them.
Where's the
senators like myself? But all of a sudden, Sandra and my original.
Sheila had the
Well, thank you.
Well, in 1 minute, we will do the roll call on the bills. Okay, thank you, Mark. Is Senator Cedillo coming?
Senator Cedillo's on his way.
Okay, we're going to start. Okay, members, we will go through the roll. We'll go through it twice for the first time. Okay, we're going to go write down this. Okay, and you can tell me how many votes I got. File item 1, SB 80 by Senator Yee.
It's 5 ayes, 1 no.
Okay, 5 ayes, 1 no.
Senator Onnested? No. Onnested, no. Cedillo? That's 5-2.
5-2, we will hold the roll open for 5 more minutes. When Senator Cedillo comes, we'll finish going through the roll now for the first time. Okay, the next item is SB 971, Senator Pavley.
Has 7 ayes.
It has 7 ayes so far.
Senator Onnested? Aye. Onnested, aye.
That has 8, I mean, we're still holding it open. It's 8 to 0. Sam was...
I'm quite popular with the Republican caucus.
That's good. Okay, file item 4, Senator Liu, SB 998.
It's 5-2.
5-2 so far.
Senator Onnested?
No.
Onnested, no.
Did I vote for that?
Yes, you did.
I thought I voted for 6. Or the other side.
We changed the numbers because a bill was removed.
Yes, that. Anyway.
Did she vote?
No, there was another, the low one bill. Did you miss?
Okay, how many votes does that have?
That was 5-3.
5-3, and we're holding it open for a few more minutes. File item 5, Senator Cox, SB 1063.
It has 6 ayes. Senator Onnested? Onnested, aye. Pavley?
Aye.
Pavley,
Excuse me, is that the Healthy Families?
SB 1063, yes, Healthy Families.
That's the one I want to vote on.
Yes.
It's good.
How many votes now?
8 ayes.
8 ayes. File item 6, SB 1064.
It's got 5 ayes. 5 aye votes. Senator Cedillo? Cox? Negretti McLeod? Aye. Negretti McLeod, aye.
The chair voted aye, yes. Thank you.
It's got 6 aye votes.
That bill has 6 votes. File item 7, SB 1109.
Senator Alquist?
No.
Alquist, no. Onnested?
Aye.
Yes.
The second Cox bill, yes.
Onnested, aye. Cedillo? Romero? It's 2-5.
2 to 5. We're holding it open.
That's the long bill.
No, that was
No, that was the Cox bill. File item 8, SB 1119.
It's got 7 aye votes. Senator Onnested?
Aye.
Onnested, aye. Cedillo? It's got 8 aye.
That has 8 aye votes. File item 9, SB 1169.
4-2. Senator Onnested?
Aye.
Onnested, aye. Cedillo? Pavley?
Aye.
Pavley, aye. 6-2.
6-2. File item 10, SB 1236.
Has 7 aye votes. Senator Onnested?
No.
Onnested, no.
Okay.
Cedillo?
How many, what's this?
It's 7-1.
7 to 1. File item 11, SB 1255. It's, we okay? Okay. File item 11, SB 1255.
5-2. Senator Onnested?
I'm sorry.
SB 1255?
1255, I am no.
Onnested, no. Cedillo?
What is the vote?
5-3.
5 to 3. Well, we will be closing down in 5 minutes. Okay. File item 12, SB 1390.
7 aye votes. Senator Onnested?
Aye.
Onnested, aye. That's 8 aye votes.
8 to 1.
8-0.
8 to 0. File item 13, SB 1431.
On a vote to 5-2, Senator Onnested?
Aye.
Onnested, aye. Cedillo? That's 6-2.
6 to 2. Thank you.
Want to change a vote.
Okay, which one would you like to change?
The Alquist bill, SB 1236.
Changing to aye? Okay. Okay, if you want to... Senator Onnested has changed his vote on item 10, SB 1236, from no to aye.
Okay.
Thank you. We will hold the roll open 3 more minutes.
There he is. Oh, shit.
Well,
we're ready for you, yes. Okay. File item 1, SB 880.
Senator Cedillo? Cedillo, aye. 6-2.
That vote is 6-2. The bill is out. File item 2, SB 971.
Senator Cedillo? Aye. Cedillo, aye. It's 9-0.
That vote is 9-0. That bill is out. File item 4, SB 998, Lou.
Senator Cedillo? Aye. Cedillo, aye. 6-3.
That vote is 6-3. The bill is out. File item 5, SB 1063.
Senator Cedillo? Aye. Cedillo, aye. 9-0.
9-0. That bill is out. File item 6, SB 1064.
Senator Cedillo?
Not voting.
It's still 6-0.
That vote is 6-0. The bill is out. File item 7, SB 1109.
Senator Cedillo?
No.
Cedillo, no. 2-7.
2-7. That bill has failed.
Granting it reconsideration?
Should we grant reconsideration? Yes, reconsideration has been granted. Okay. File item 8, SB 1119.
Senator Cedillo?
Aye.
Cedillo, aye. It's 9-0.
9-0. That bill is out. File item 9, SB 1169.
Senator Cedillo?
Aye.
Cedillo, aye. 7-2.
7-2. That bill is out. File item 10, SB 1236.
Senator Cedillo? Cedillo, aye. It's 9-0.
9-0. That bill is out. File item 11, SB 1255.
Senator Cedillo? Cedillo, aye. 6-3.
6-3. That bill is out. File item 12, SB 1390.
Senator Cedillo?
Pardon me?
1390.
1390 by Senator Corbett.
Final item 11.
It's 12. The number's changed on us since we removed a bill, yes.
Senator Cedillo?
Cedillo, aye.
Cedillo, aye. It's 9-0.
9-0. That bill is out. And the last item, file item 13, SB 1431 by Senator Simitian.
Senator Cedillo?
Aye.
Cedillo, aye. 7-2.
The vote is 7-2. That bill is out.
Thank you.
Thank you. Meeting adjourned.